I'm going to call this meeting together of the Commission to Study the Cost of Special Education. We are here today. We'll discuss some of the issues which we brought up at the previous meeting. However, we're going to try to move right into as quickly as possible into addressing our mandates in SB 57. And one of the primary responsibilities is listed on the top of this agenda, revenue sources to reduce the reliance on local property taxes. And we have 13 tasks which we are directed to do in SB 57, and I've broken those out, and they're identified as you go down further on this agenda. And I've also placed some of the information that we have received. It's none of that's finding information. It's just information that's been received from various sources. And so we'll be discussing that too. So the first thing I'd like to do is we do have Megan, you have the minutes here from May 18th, 2026, and I see you've just passed those out to us. Has everybody had a chance to look at those? Just let's take a few seconds and look at those, and then we'll have a motion to approve. You're pretty good at doing these minutes. You got everything there.
Do my best.
Wow. It's okay. Representative Ames puts forth a motion to approve the minutes,
I'll second it.
and second by Representative Dry. These are the minutes from May 18th. Does anybody need further time here? So let's move that motion. All those in favor of adopting the minutes from May 18th, please show your hands. Any opposed? Any abstentions?
Abstention, I was not at the last meeting, Mr. Chair.
Naughty, naughty, naughty. Okay. Okay, the two abstentions and 1, 2, 3, 4, 5, 6. Yes. Yeah. Okay, I don't see anybody here from HHS, even though we mentioned it. I mentioned John Williams, or from TANF, for any of those other areas which are involved with the costing or the money revenue sources which support our students, which are residential placement centers. This is a huge component. I'm not so concerned about that today, seeing that we have passed a bill in both the Senate and the House. It's HB 1099. It's spoken to in the minutes right here that we just adopted on the first page. Mr. Stock, Jason, is presenting and explaining HB 1099. This sets up a committee study to look at what we're looking at right now, to address the issues that we started to arrive at. And I would suggest that these minutes be provided to that committee. In fact, if you go in these minutes that are in the agenda items, let's see if I'll get you the right page here. Yeah, it's on page 5. It's number 3 under item H, the local district costs for out-of-district placement and if other options were available. Item 3 reads, the bill as amended in committee directs the study committee, that we're talking 1099, to not only consider the cost and liability of providing general education, special education service to students placed in residential placements facilities due to an episode of treatment or court-ordered placement, but to also include other education placements such as those done by school districts. The committee shall look at funding sources and services costs associated with treatment, education, board and care, and costs to receiving districts. The SB 57 Commission to Study the Cost of Special Education, which concludes on July 1, will make available residential placement report information and findings to assist the 1099 Study Committee. So anything we've gathered, we can pass on to them. Yes, Representative Ames.
Just wanted to note, not sure you mentioned it, but the deadline for a report by that commission is just a few months away from where we are right now.
Yeah, it's also
and,
November.
July 1, right?
No,
No,
he's talking about the
November.
committee,
yeah, the
1099 committee.
I'm sorry, committee, 1099 committee, and that's gonna be hard to conform to. The first issue will be getting people appointed, and then hopefully they can build off of all this work we've done.
I concur, and having done this many times before, being on these committees established, and then have to have a report a couple months later, you have basically about a month, maybe a month and a half if you're lucky, to really get something done. That means they're going to have to be meeting quite often to look at this. I am concerned. I feel that Mr. Stock brought up some issues regarding Northfield or Winnisquam and students which are placed in Spalding and become residents of that area, but they then go to Northfield or to
What is wrong?
Winnisquam, and there's no ADM following that child to Winnisquam in some cases. We heard that. So they're basically having to educate a child without the revenue stream coming in to support that child.
And I'm sorry.
Go ahead.
The issue pushes back at the individual child too. It's not just the school district that struggles. It's the child where responsibility is unclear. That's going to sort of be the place where that confusion is going to come to bear in a potentially damaging way. So it's really an important issue if you look at it from the perspective of both the local school district and the individual child.
Yeah.
So it's good that we've got a special commission to look at this, and a committee. Is it called a commission or
It's a committee.
committee? And I just hope that they can get something.
I do too. And another thing which was a concern to me, it was said here, and I left a little bit confused. Rebecca, you might be able to help me out on the transportation of students dealing with this least restrictive environment, that we have students that could be transported daily between Spalding and Claremont, or Spalding and Berlin. And we're talking about transportation costs. When I talked to several folks that were in the legislature, and they said, yes, that's occurring. And we're spending over $100,000 in transportation costs for these contractors, and probably much more. What is that actual cost to the state? Either, and who's paying? Is that an education cost, or is that a cost associated with one of those other revenue sources we saw on the sheet on the left-hand side, going right down in foster care, you go into the Title IV-E, you go into the general fund, you go into local education agency monies, you go into the HHS, DCYF. Who's paying for all this, Rebecca?
So I can speak to the special education. If the student is identified as a student with a disability, it falls under the episode of treatment payments that we make out of the Department of Ed. So they would submit to us for us to pay that directly to the vendor. I believe that DHHS through BCBH or one of their other entities pays for the transportation and education for students without disabilities. But I don't work there, so I don't want to say definitively that that's what they do. But if it's a student with a disability, the district submits all of the transportation bills to us, and we would cover them through those EOT payments, episode of treatment payments.
Mr. Chairman, can
Yes.
I ask,
Tim.
Rebecca, would that be the same? I mean, if the student was there on an EOT, and I understand that, but if the student has transportation services identified in their IEP, it would still be EOT money and not the local district's responsibility?
So if the student was placed for an episode of treatment, all the costs all special education costs are covered for the episode of treatment, or if they incur transportation costs because of the episode of treatment, it's covered. So it would cover both of them.
So either way, it's EOT money, even if the transportation service was already in the IEP.
Yes.
And that, just as a follow-up to the Spalding testimony we heard, because I was quite concerned that we heard that 3 students are placed there that have no educational programming at all from Spalding. So I did reach out to Marie Noonan and Daryl Tenney, and they were gonna look into that, and I haven't heard anything back, but I kind of said, look, guys, I don't even think these are special ed kids, but I just heard testimony that they don't have any school, and that's not okay. But I again, with the special ed placements there, I still am wondering why a student is placed at Spalding that is not identified for special education through an episode of treatment. There are kids there who would be earning credits, but they can't because Spalding doesn't offer them. And it just seems to me that the placement of that child was not done correctly. It should be a place where they can access education, not.
So as I understand it, it's an approved portion of their program through DHHS. It's not so we approve them as a private provider of special education so they can have a school and students with disabilities can attend that school. This is a different approval through DHHS that allows them to take subacute, or they have, I don't know all their categories. I have enough of my own categories, but allows them to take those students, and then through that process, because they don't have a school, they would send them to Winnisquam. I don't think that there was, when that was developed and it was created, I don't know that Spalding or DHHS reached out to Winnisquam and said, this is something that is going to be in your district and you're going to have these students.
So, in a minute, Margaret, I'm looking at a sheet that you handed to us that looked at the costs for EOT, episodes of treatment. And in 2025, you have $5.9 million for an episode of treatment. And I assume it's climbing for this year as well. So I guess, Tim, I have the same concerns you do. If,
Turn it on.
yeah.
Can you just pause a moment so we can all get oriented to that? Where is that? Is that a previous handout or is that?
It's a previous handout we have. You may have it.
That's the beginning of it.
It's probably in your pile of stuff. As I was looking through this the other night, I said, wow, this is.
Too much.
So this is being appropriated from, where does the money for this episode of treatment come from? It comes from
The state.
That's right. That's right. And it's administered through the Department of Education.
Correct. Through the Bureau of Special Education.
And yet we're using that for supporting HHS in the transportation of kids. Is that correct?
If the student is a student with a disability, then the bill language allowed for all costs of those students to be covered through this fund. Yes.
So then none of this $5.9 million in 2025 would be used for students that are being transported, like we've talked, from Berlin to Spalding or over the other side of the state?
As I understand it, those students that we're referencing at Spalding are not students with disabilities, so this would not be covered by the fund that we administer. It could be covered by a fund through DHHS.
Is there any statutory language which says this is how it works, or is this just a handshake that's been done somewhere along the way?
No, we had a bill that passed, it would be 3 years ago now, and where it changed our state aid language and it added episode of treatment payments in with the court-ordered placement language. And so that it's in the law that says we'll pay for our court-ordered placements and episodes of treatment.
And in that same year, the court ordered placements for $5.2 million.
Yes.
Okay. Margaret, you had a question and then
Thanks. I'm just still trying to wrap my head around all the different categories that we're going to have to deal with in this one, because it was nice when they went to Spalding, they had their courses, or they went to Winnisquam, but when they went to Spalding to live and went to their home base to go to be educated, it just seems like every single person is a special, different kind of case. Can we do something that covers all of those? You know, it just seems to me an awful complex area to do.
And I think that goes back to the DHHS bid process, the best interest determination process. So when a student is going to be placed for an episode of treatment and they're not a student with a disability, they have what's called the bid meetings. And they determine what's in the best interest of the child. Is the best interest for them to continue to attend their home school, you know, which in that case is Berlin, so they travel, or Claremont, I think it was, or is it in their best interest to go to Winnisquam because it's right in that area? So those are all made on an individual per child basis in those bid meetings by the team that's involved with that,
And those are for students who do not have IEP.
who do not have IEPs.
So just trying to think about how to legislate this, or to put that in kind of some kind of a box, and then basically it stops at the best interest thing, and it can go any direction from there, but everybody kind of gets through that gate.
Yes, and just to clarify for Representative Murray, they do this for special education, but that comes into play in that discussion. It's, you know, this child is receiving this for special education, so if you're going to place this child, these are what this child needs to meet their IEP. So they all get the bid meeting. It's a different type of determination.
who conducts the bid meeting? And who is a member of the bid meeting?
So it's not a Department of Ed process. I'm not clear on all the partners. It is somebody from DHHS or a contractor that they have. And then they're supposed to invite the district of residents. Tim might know more of who's in that meeting.
So there, for episodes of treatment, there's 2 care management entities in the state, Connected Families in New Hampshire, as well as NFI. And they have these NFI. Yeah, they have this.
What's it stand for?
Northern.
It's an organization?
Yeah. There are 2 care management entities that under that umbrella. They have what are called TREC workers. It's a treatment, residential, whatever. It's designed to make sure the case stays online and that the kid comes home as soon as possible. Because there isn't, in these cases, there is not a child protection social worker or a juvenile probation officer. These are outside of that realm. So that person who is essentially the case manager for that episode of treatment would be there. The sending school district would be there, and the placement provider would be there, as would the family, or guardian, I should say, and that they would decide. It's not the same as a Rebecca. It's not the same as a 193.3 best interest placement, really.
Explain that, Tim, because some of us do not.
Yeah, sure. That's essentially a process where a parent can go to the superintendent and say, there's an educational hardship. My child needs to be placed XYZ. And outside of special ed entirely, a superintendent can agree, yep, we'll place your child at such and such.
Talking about manifestation.
Manifestation hardship.
Right, and they will do that. So it's not that either. This is some third version, and I think to some extent it was brought to life because the Maximus folks, who are that's the company who does this assessment to decide where a kid gets placed, we're not really doing well with getting in contact with school. And this sort of ensures that there will be some representative of the district the child came from at the table. So that's usually who you would see. I have been at a couple. My office has been at a couple just because we may be working with the family on a different child in there. It's not really that different, except to sort of align, can they do this service? If not, who can bring in a private person or something to solve that one little issue? But it's not It's not the same as the manifest hardship. So when we talk about
Manifest hardship, sort of like in a different category of.
it is, but we talk about best interests in the manifest hardship too, but it's not the same thing. It really is. Is it in the best interest for this child to, if you think of it this way, I had one where the child is from Rochester and they were placed residentially somewhere else, far away in the state, Campton. And the meeting was, should this child be transported back and forth to Rochester every day? And the team felt, no, we're putting this kid in the car for an hour and a half each way. And so that was the hot topic of the best interest. But certainly if it were, 25 minutes away, it's absolutely doable.
The costs that are associated with this in terms of transportation, I imagine, are huge. And I'm concerned, Rebecca, is there anything in statute, more in administrative rule that addresses the issue and tries to define when transportation is appropriate and when it's not, and when distance comes into play? Is the least restrictive environment then not where the child is from, but maybe perhaps where some of the other locations might be that are closer?
Are you speaking purely in regards to an episode of treatment?
Well, I'll open up wider so
it's
that.
two different answers.
Is there, if there, in my reading of the administrative rules, I've seen something where transportation is discussed.
So in general, for an IEP team, transportation is discussed if the child needs it in order to access their education. It could be an adaptive bus that will take a wheelchair. It could be any of those types of things. For an episode of treatment, the cost is covered if it was already in the IEP, or there is a cost because of the episode of treatment. So if the child needs to be transported to a certain location because of the episode of treatment, it's covered in the cost of the episode of treatment and paid through that fund.
So it's essentially subtracted for that episode of treatment, the transportation costs are subtracted away from the district of residence's responsibility temporarily.
All costs for special education are temporarily transferred to the episode of treatment fund, including any costs that would incur for transportation.
Good to know. Good to know.
I have a question. If someone is placed there, and this is probably, I wish I should have asked it when Mr. Lippman was here, if a child is placed through an episode of treatment, Medicaid is paying for that episode of treatment. The educational portion is coming out of the state fund, but Medicaid is paying for the overall. I guess I'm wondering why that transportation, if it's transportation to and from treatment, cannot be covered by Medicaid.
It's typically not transportation it's transportation to a school typically.
But at least one way back to the treatment facility.
And I'm not sure all of them are covered by Medicaid. I think some of them are covered by private insurance because it's the parent, it's a voluntary placement with the parent. And so some of them use their insurance. I don't think they're all Medicaid.
I never had an EOT that wasn't Medicaid, but I'm just wondering, like, if at least one of those transportations, if somehow that were billable to Medicaid by either DHHS or the school district. It's just thought, like, could funds be accessed from Medicaid for that transportation?
I don't know enough about the Medicaid to be able to say that that's.
Did you just ask if they could be billed directly to Medicaid?
Yeah.
Okay.
Yeah, if I've worked with populations where they need transportation to and from any therapy appointment or things like that, and they're covered. They get reimbursed anyways. I'm just wondering if that could be done here.
Yes.
With that,
Go
I
ahead.
just had a
Follow up.
question.
Yeah.
In speaking about sort of those, when a parent has signed off initially for an IEP, or it's just an IEP rather, I don't know, but to give permission to explore to see whether or not the child is eligible for Medicaid services, is that what we're asking here?
It's so for school districts with Medicaid, the process would be that the district every year asks a parent if they are willing to sign off to see if the child is eligible for Medicaid. The district then does not know who is eligible for Medicaid. They track all the students that they have permission to track, and they submit for all the students they have permission to submit for. But then when they get the payment, they don't know if Johnny and Sally were covered or if Charlie and Betty were covered. Like it just gives them money back because they have the permission for that. It doesn't spell it out as to who it goes to. So each year they would ask for permission to access Medicaid from from all parents, and then they would submit for that.
One of our tasks that we have, Medicaid to Schools program, including whether billing is in-house or outsourced, and its relationship with student data privacy. I'm concerned about the privacy. When we've tried to have a check off on Medicaid and all kinds of attempts, we haven't been successful on that, I don't believe. Are there any privacy concerns that we should be addressing as a commission here, that the Medicaid information is available to folks which people don't want it available to?
So, as I said, while the parent may sign off and say that you can attempt to access Medicaid, the district does not receive information about who is eligible for Medicaid.
Okay.
So if they submit for 10 students because 10 parents said, yes, you can access it, and then they get a check back for anything that's covered, they don't know which of those 10 students they received funding for. So the only issue that we have, there's no issue. It's the parent says, yes, you can try, and then they try and they get some funding, but they have no idea who they got money for.
And that is to protect student privacy
Yep.
and health.
Okay,
I
back
don't
to
understand that.
Representative Freeman?
No, I'm good. I'm just muttering.
Okay,
I'm good.
okay, good.
Thank you.
So we're not obviously going to get down to the bottom of all this stuff, and that's why we're going to have to pass this on to the committee, and that's the purpose of that committee. But I think what we ought to do is what we pass on to them, we ought to be pretty specific in finding out what are these holes that we have got hung up on. And so they're not starting to explore the same stuff we are, and then nothing's done there as well. So we ought to be prepared when we get to that part to really, yes, Rebecca.
I think one of the things that we should pass on to the committee is that Winnisquam was not aware that this program had been approved within their district. And so that was part of the issue for Winnisquam, is they didn't know that there was the potential for 10 or more students coming into their district from an approved program at Spalding. So I think that may be one of the issues that they want to look into, is there should be some notification to the district to say, you have the potential for having 10 more students come into your district that you would have to incur the cost for, that you didn't know about when that approval is given through DHHS.
So when you approve an organization like Spalding to provide these services for these students that are residentially placed there, and some of that academic program is provided there at Spalding, at that time, you're doing that approval, is that approval noticed to the school administrative unit or the closest one? So you may be capturing some of these kids.
So two separate things at Spalding. They have two types of kids. For the students that we approve their program for special education, the students are attending Spalding. They go to the school at Spalding.
Yes.
They attend there. For the students that are placed through this other program, they will never attend Spalding because Spalding is not a diploma track program. We don't approve them to provide diplomas. They use a modified curriculum. They don't meet all of the minimum standards. It's for a certificate of completion. So those 10 students that DHHS approved that program for, there was never an intention that they would attend Spalding. There was always the intention that they would either attend their home school or they would attend the district where Spalding is located. What I'm saying is that Winnisquam should have been notified that there was the potential that these students would be attending that school.
And the money should have been available to.
That's your
I'm sorry,
decision.
Mr. Chair. And the money should have been made available
Who does
to mitigate
the
that.
notification?
There is no notification.
Well, who should do the should Spalding do the notification to Winnisquam? Or should
DHHS.
DOE?
It should
or
be DHHS.
HHS?
DHHS is approving the program for those students.
Yeah.
I would say not to, they're not here to defend themselves, but I would say DHHS.
In court cases, when you place a child, if I were to place a child that could attend Winnisquam at Spalding residentially through a Chins case, I would be joining Winnisquam and the sending district as well. They would both have to be notified. But in this voluntary situation, that doesn't happen unless somebody really kind of tries to go out of their way to do it. But I agree with Becky, when we grow a new program like these are newer programs at Spalding. They did not previously exist that are, they are for all kids, not just kids that are identified for special education. They could be, they're able to attend a public school. It really should fall on DHHS, who certified them, to say, hey, district where this placement is located, just so you know, we added 10 beds or something. I think that could be a recommendation that the 1099 committee looks at, is like these districts have to be notified the same way they are if it is a court case. If it's a court case, it's very clear. It goes out with an order.
They need to be notified when the program is approved, because
Yeah.
you're saying that you could potentially put in here. So they need to be notified when the program is approved. As to the funding, that's something that legislatively you would need to look at.
I just wrote the bill. I just wrote it.
Well, we need to get that in our minutes here, Meg.
I'm getting it done. I just wanted to
I'm
hear you
really
guys.
concerned of how that district knows that their ADMR may be increasing as a result of these students which are there.
They were not told.
Yeah,
Winnisquam,
see.
in this case, I don't know of other cases, but in the case of Winnisquam, they were not told there was the potential for them to get 10 new students.
Is this seen in other locations other than Spalding in this state?
Turned it off and I thought I turned it. I cannot speak to that. I'm not sure, because it's not a special education program. I was aware of this because I was brought into it when Representative Hill came to the department to talk to us about it, asked us about it, and we realized it was not special. We thought it was special education students, realized it was not, and then it's gone from there. So that's my familiarity with it, is because it was initially brought to me to say, we think this is students with disabilities, and it turned out not to be. I don't know of any other places in the state, but I would assume that there probably are.
May I just want to make sure that I'm being very careful and intentional about noting this. So I just said that that you're asking that we pass along the issues that are that came forward at Winnisquam, because really Winnisquam had no idea that they could be receiving more students through this non-diploma track program.
Through the diploma track program.
Oh, sorry, thank you.
Yep, because the Spalding Youth Center's school is not a non-diploma, but these students would be.
And then that the 10 students that were approved through DHHS were never intended to go to Spalding, therefore there was no notification, and advocating that DHHS notified both places, Winnisquam and Spalding, and the district of residence.
No
as well,
notification
upon
and
approval.
no fiduciary.
Um,
No fiduciary, no money.
And then Tim is advocating that, noting that it's a voluntary program and that this type of notification isn't happening in the voluntary program, and it should fall to DHHS, who certified the students, and that the district of residence and receiving districts need to be approved and notified.
And it would be certified the program, and then the students are placed within the program, so it's certified the program.
Could you just add one thing to that should be DHHS or designee? Because I think that's what it will be. It will be the care management entity that's
Okay.
required to do it,
You got it?
not the DHHS.
Yeah. And
Person.
then you got it. Okay. Thank you.
Would a student at Spalding also be eligible in some way then to attend a career technical education center?
Those students, yes.
Yes.
Yep.
And so they're not going to get anything at the CTE center for that either.
Unless they're in one
Are
of
they
the sending
tapping into that
districts.
transportation money, which we put in there, that $9 million for tuition and transportation each year of the biennium? it's actually for transportation, it's not a heck of a lot, where, you know.
They wouldn't be tapping into that because they're
less
not
than a-
students with
less than $1 million.
disabilities.
Yeah.
Yeah, they wouldn't be tapping that because they're not students with disabilities.
They're not with a disability.
So the EOT funds that we have at the Department of Education are only for students with disabilities. Every other cost for an episode of treatment goes through DHHS.
So Spalding has kids there that do not have IEPs.
Correct.
That's the kid that I'm concerned, Representative Ames.
Yeah, I think if it's a program for 10 kids, let's assume, that not all of those 10 kids are going to knock on Winnisquam's door.
Yeah.
Some are going to go to Berlin because maybe that's what their parent wants, and it's basically a private placement in this program. That's one of the categories, isn't it? It can be private placements.
Sure. No, absolutely. I mean, it could be charter.
So,
It could be any flavor.
Yeah, it could be a CTE destined child and somewhere else. So it's almost, you have to sit, you can't do it, but you sit down with the 10, you try to model this and have 10 different possibilities and have a system that responds to the full range. But it's not going to be, okay, Winnisquam, you're going to get 10 kids because we started this new program. I don't think that's right either.
So are you advocating for, I just want to make sure I'm hearing him correctly real quick. Representative Ames, you're advocating for wherever the child ends up being educated, whether it's Winnisquam or the resident district, or charter private school, that they also be notified based on where the diploma track student is going.
Well, I don't think you can do it ahead of time because
No, but
you
you're
don't know.
Okay,
I don't know.
so that's,
It's not one of these problems that can be answered categorically across the
That's
board.
my point.
Yeah.
Yeah.
so you're just asking for that facet to be considered, that there's other places that they can go other than Winnisquam.
Yeah.
Okay.
Any further?
Yeah.
Yes.
Well, I just like to bring up what Representative Freeman was saying is, does money follow anybody when they do that?
Only students with disabilities.
Mr. Chair.
Yes. Representative Freeman.
Thank you, Mr. Chair. Ms. Fredette, how many students were we talking about that do not have IEPs that had those placements at Spalding right now?
I believe they have, when they came last time, I think they said they had 12 or 13 because they had students that were at Winnisquam and then they had students that were not in a placement currently. Was it, Tim, do you remember?
Yeah, and I am somewhat aware of a couple of those students that are not in those newer programs. They're in the traditional residences, but they are not identified yet for special ed. Sometimes those workers reach out to my office and say, look, this student has a lot of needs and we think that they have just not been given an IEP or the parent hasn't advocated or whatever. Would you help? And so there are times I've gotten involved and we've worked through that process with a district. So yeah, I think the program in question that is really designed for kids to be educated somewhere other than Spalding, I'm going to put it that way. I think that's 10, but I think there's a couple of extras in their traditional program that they're trying to take as many kids as they can, is my belief. So.
May I have a follow-up?
Yes, go ahead.
Thank you, Ms. Fredette. I appreciate your time. Given those 10 to 12 students that are at Spalding who do not have IEPs, are not special education, does Winnisquam have any agreements with their home district on reimbursement? Because we know that somebody's getting paid for these children, even if they're not attending their home district. Do we have any agreements? Does Winnisquam have any agreements with them?
As I understand it, and as our attorney Liz Brown had explained at the last meeting, there is no agreement for those students because they are not students with disabilities. So any costs would be incurred by Winnisquam, but by law, there is no payment to Winnisquam from those districts of residence.
And one more follow-up. Thank you. So we are all naturally concerned about the welfare of that child, whether they're special ed or if they're not on a special ed track. But in the interim, we also should be very cognizant of cost, because if we're spending money on things that we need not spend money on, or there's a bucket of money here and it's full and there's an empty bucket of money here, then how do we mitigate that? And at some point, Ms. Fredette, maybe you and I can discuss when those situations come up, agreements with the home district to the sending district. It was just something that we've been trying to work on to begin with. So I'd like to get your feedback on that at some point.
And I believe that Liz Brown had said at the last meeting that the law does not allow that to happen.
We can change that. Thank you very much.
It would be nice to know what section of law to look
I
at.
can ask her to give me the reference because she had looked it up when we first. It may be in the minutes.
Yeah, there were three or so statute references.
That could be a recommendation we make to this 1099 committee. Maybe this is maybe this is an RSA that warrants some attention, and maybe we can modify it so. We're on an even playing field financially. We want these children to get what they need, but we don't want to make these receiving school districts broke in the interim.
At what point does all this fall down on another committee or another commission versus having our departments engage with task force or putting the professionals together from HHS, from DOE, from the resident area, and working this out so we can get some uniform policy here in this state. It may be happening up in my district too, where we have Beckett right there. And I'm sure we may have it going on. And they're a large outfit that's in Maine, New Hampshire, and I don't know if they're anywhere else. So why is it that that you don't have the time or the staff to do it, or because there's an issue here and somehow we're going to have to try to resolve it.
Yep.
I think it's very unfair for one district to receive kids and not receive any accompanying money. That's a cost. I don't think there's anybody that disagrees on that here. So how do we fix this? Well, maybe we put it as a top priority for that committee, but also, Rebecca, in talking about this least restrictive environment, when I talked to the commissioner of ed, and she indicated to me that we can't do a whole lot of this until we address this issue of the least restrictive environment. And that is a decision. It's not made at the state level. It's made at the local level. And so we make the decision that the least restrictive environment is Berlin. But the child is now located in Northfield. And we see it in regard to some other, issues too with the homeless situation where we have kids that are placed where there's housing, maybe, and not in my town, but they maybe have to go down to Hanover, Lebanon to find that. So we have to transport back and forth daily. Is there any attempt to really define least restrictive environment on the federal level that it can give us help here or within the department?
So least restrictive environment is defined within IDEA,
Yes.
and then we lay out the parameters of it with a continuum of educational environments that are suggested for placement for students with disabilities. There's not something similar for students without disabilities, but it is defined within IDEA, and within our rules, we have a clear path of this is your pathway or your list of different levels of restriction, basically.
Yeah. Do you know of any cases throughout this country where the least restrictive environment is governed by distance. And where we have a student riding on a bus for an hour and a half each way.
Not under special education, no.
Right, but I was saying, outside of that, I think there are considerations, may I?
Yeah.
That McKinney-Vento status, which is essentially those
Well,
students who are
that's the one I was
unhoused.
talking about, yeah.
McKinney-Vento status speaks to meaningful relationships and whether or not a distance is appropriate for a student to be traveling X, Y, Z amount of miles. So but that's a different area
Yeah,
altogether.
I'm familiar with McKinney-Vento and been through that up in Haverhill with a kid living in Lebanon.
And I think, to my knowledge, it has to be a meaningful sort of.
Yeah. Representative Ames, your attorney, help us out here.
Well, way back, somewhere in the distant past, I was an attorney representing some kids who were in these almost impossible categories. And one of the all I really want to say is that this question of what is the least restrictive environment or service or program for this individual kid is a core concept in the law, but it is one that resolves itself only around that particular student and that particular student's needs. So there's not going to be a rule that says that if it's a 2-hour drive, that's too much. I don't think.
And I think the equivalent to that for students without disabilities is that best interest determination meeting. Like that's the only other equivalent to that type of determination for least restrictive is looking at that through that lens.
Okay. Well, I think we ought to jump on to another topic right now. I don't think we're going to get resolution on this, but I do think we've found something we want to communicate with the upcoming committee.
Exactly.
Yeah. Going down here now, I think we ought to be looking at the commission study responsibilities. And there were 13 of them. But the primary overarching issue, which was that's SB 57, was to locate or look at revenue sources to reduce the reliance on local property taxes. And we tried to look at HB 1563 this year and trying to provide more revenue stream through the state. I don't know if that's a significant change, but that is a change where we're trying to,
What page again?
1563?
Oh, I'm sorry. On our notes.
Yeah, we're just looking.
Okay.
Thank you.
1563 identified several of the issues which we are looking at. One of which it did just, as we've talked about before, it started providing source of revenue to the locals at 2.5 times the average per pupil cost versus 3.5 times the average per pupil cost. And from 2.5 to 3.5, the state would kick in 15% of those costs, and the state would have to pick up the 85%. Once you get to 3.5 to 10 times the average cost, it's the same as it is right now, 20/80, 20% by the local, 80% by the state. Once you get over the 10 times the average per pupil cost, then this bill changes it so there's 10% of that additional cost that's when you get over like up to $200,000. 10% would be that of the local and 90% would be that of the state. The reason why it was dropped down to 2.5, we're trying to get more information on how many kids are coming at special education aid. We don't have that information available to us, so we dropped down incrementally. I was a little disturbed that we kept the proration amount at 80%. I would like to see the proration jump to 90% and eventually in another year have no proration. The state is obligated to pay whatever it is. Like that, we allocated what was back in 2025, was it? $34 million roughly. and came out $16 million on top of that. And that prorated what you received in the districts. That was another hit. And you know, how we reduce the need for the local to generate is one of which to get rid of the proration. And so I would like to see that come down as a recommendation from our group right here.
Are you talking about the proration for all categories, regardless of the costing of the actual service, or are you just talking about that initial group?
So it's the proration for special education aid. If we, if the total number of special education aid we receive is more than the amount we are allocated, it would be prorated to 80%. If we didn't have enough, we would ask the governor for more funds to make it 80%.
And we do have a sheet on that too. Go ahead.
To prevent the 68% that we had last time.
Correct.
Okay.
It's interesting to note, though, that the amount which was prorated this last year was 90.14, something like that.
It was 91, almost 92.
Yeah. And so, and then we can go back to like 2023 when it was 98%, and go back to some years like in 2012, it was 69%. And so that it seems to be this peaks and valleys if we don't appropriate appropriately, but we don't know. I don't know how you're even arriving at what you estimate your cost to be of those to be eligible for this fund. So I'd like to see us consider not having proration.
Well, that's exactly. Yeah, if I may, the rule is no proration. And then we've got proration coming in to address the reality that not enough was appropriated, right? Yeah. We write it into the law that there will be a proration allowed. And that ends up being the target, the amount that's appropriated, probably. And I think it would be good in our final report to say that this expectation that the cost produced by application of the formula will be then reduced further by a proration process should be is understandable as part of our history, but it should not be allowed to go forward, something like that. We should address this proration issue just as you just said, in a different way. There should be no proration.
Yeah. And this has been hanging around the legislature for years. Mary Guile and I both bipartisanly put forth to up the proration. I'm talking back when it was like 69%. And that was such a hit that we put in 80%. Well, 80% is where we are right now. And the bill as it was introduced, 1563, had 90%. And with the hope that when we get more information available to us, we'd be able to appropriate or have the data to help us identify what we need for funds. So we wouldn't have to have proration.
Just an additional note on that. Almost in the same breath, the same paragraph, we need to also say that the state should pursue higher levels of federal funding to keep trying, flag it all the time, and 40%, right? It was the original.
That was initial hope.
Yes.
Yeah.
And it's now 5.5%.
So that I think that should be a part of this statement about proration.
Yes, Representative Freeman.
Thank you, Mr. Chair, and I'm very glad that Representative Ames brought that up because I really think we need to do a deep dive on why we're only getting 5% when we were promised from the federal government 40%. Is there something we are not doing? Is there something they're not doing? Why is it that we don't receive what we were initially promised? Have changes been made? Rebecca, do you have an answer to that question?
It's not unique to New Hampshire. It's across the country,
right.
and they don't allocate enough funds to meet the 40%.
Right.
And may I have a follow-up with that, Mr.
Yes,
Chair?
yes.
Thank you. So, Ms. Fredette, this is a wild thought, but the reason why we received that piddly 5% is because we agreed to follow all of the standards in IDEA and the federal DOE special education requirements. Is that not correct?
So we received the funds because we agree to follow IDEA. However, if we did not accept the funds, we would still have to follow IDEA.
Yeah. You don't
And that's the truth,
Yes,
really?
yes.
Yeah. And by the way, so we don't throw this 5.5% around. We spend roughly close to $1 billion on special ed, $977 million, of which we know that our differentiated was roughly $68 million. We know that IDEA is right around $50 million, and special education aid, if you add the 16 on top of the 34, or whatever we're allocating this year, it's probably 49, somewhere in there. Let's call it 50. So 50-50 and it's 68, 168 million out of 977 million. When you do the math there, we are receiving this, the feds are kicking in 5.5% of what our expenses are. Now, it's never been that low. The government's always said, well, it was passed initially with the hope of getting to 40%. I don't think they've ever been there. And so, but it's dropping more and more and more. And yet, and the other side of this coin is what we have here at the top is, according to what I get in our percentage, roughly around 20% of our kids have an IEP. So that's higher than the national average, according to Ed Humanics, which we got that from Melissa White. So from the department, yes.
And
Wayne.
Representative, the preliminary allocations for next year for IDA and preschool came out. And for our two districts that I work for, our allocation is flat. It is no different than it was for IDA. I mean, I say flat. In my world, flat is a couple $1,000s difference. That's our allocation for next year. And at a minimum, with no change in any of our placements or status or any of our students, our costs have gone up. So IDA continues to pay for less of what is actually happening in districts.
Representative Murphy.
Yes, thank you, Mr. Chair. I agree. I think we're all sort of sitting here with a recognition that IDEA was passed, 50 years ago? It's the 50th anniversary this year. And these are choices and commitments, right, that we're making to our most vulnerable learners. And so whether it's 5% or 5.8 or 8% or 12%, it's not enough. And when we're asking for all of those sort of things to be considered, a reduction, as Chair Ladd notes, or a level funding circumstance for preschool, it's not acceptable.
Yes, Representative Ryan.
So I'm just going to follow up on this a little bit. You're saying we got the letter last time from Senator Hassan, and I think we're in a unique position as state because both Senator Hassan and Senator Shaheen signed off on the IDEA full funding bill, and it's in Senator Hassan's committee, and it's been that way for a couple of years now. I think, who else has more pull than her constituents, and who else does that than the special commission to study special aid costs? So I think we tried in the House. We spent a resolution 2 years ago saying we want this fully funded. It was a resolution in the House. That's where it went, But it's not like we haven't said this before. But I think that we are in a unique position to ask, just say, we've been studying this. This is a problem. And you have the solution. You are both sponsors, and it's in your committee.
And may I?
Yes.
Representative Dry, I did read the letter, and my understanding is I think she did note that she is advocating for that, and she notes that that there is, in her response back, that there is not adequate funding, and she would like to see that fully funded. So I think that if we can continue to advocate that way. And, you know, whether that's something from the commission sent that way with all of the members here. I'm sorry? No. And so in any case,
I think that,
We set our
we-
own standards.
I think what we're appropriating, if we're having to do this proration, we're absolutely inadequate in what we're doing there. But I think there's other causations which we need to look at. And I tried to address some of those as we look at this. And maybe what we ought to do is walk through some of these areas where I placed some information on the first page here, where student referral rates for IDA category for special education programs. We are seeing some areas where the category, that IEP category, have increased dramatically. There was an article, again, which appeared in the Wall Street Journal just today, where they found fraud in the development in Florida, where a family was billed $900,000 for 4 contacts, a visitation, or that the family wasn't billed this. Medicaid was billed it, and they caught it, and they did not pay it. But for service provided for this autism at home for 4 visits, it was just fraudulent. And in fact, even closer home, my own wife found on her Medicare report that came in billing for a family in Florida for catheters in the amount of $1,000. And Margaret and I have never been in Florida in the last 20 years. And it had the doctor's office and all that. And she called Medicare last night and they responded, "We did not pay it. It is fraudulent." So they're getting a hold of people's records and billing Medicare or Medicaid for these costs. And the people that are supposedly receiving it don't have a hot clue. So we got to be careful of the fraud that's going on. But autism has jumped significantly. In year 2000, we had 397 cases. In 2024, we have 3,990 cases. And of course, we talked about how the criteria has changed. The Center for Diseases Control has changed that, and that's in here somewhere. Rather than jumping around through this, I'd like to take some time, if we may, and just go through some of this and see what your feelings are on some of these items here. And if we don't like it, take it out. But, you know, we've got to start doing something.
This is good.
Yeah.
okay, so I will be ready to start taking notes.
Okay, I'm just going to walk right through A. We received, at number 1, statewide census for by disability, ages 3 through 21. And we've seen that the disability category total increased from 30,000 to 32,000 students between 2000 and 2024. Yet our demographic dropped from 200,000 to 157,000.
Quick question.
There's a question there.
I got a question.
Yeah.
When we say the disability category increase, what's meant by disability category? Is that
Those 13 category IEPs.
it's IEP?
Yes, those are IEPs.
That's what I'm after.
But you were talking about the categorization, right? Like other health impaired, OHI, et cetera.
That's
later.
all, but the sum total.
The sum total.
Was roughly 30,000 versus 32 or 30,000 now. In other words, what I'm trying to say here is our population in the schools is decreasing, yet the number of kids with IEPs is
So
increasing.
to pursue the question, take the EFA program, and we are paying out differentiated aid for children with a disability. Is that how it's? There are these are children that do not have IEPs are included as creating eligibility for the differentiated aid.
And I do have a recommendation for that too, that's
Yeah, but
later on.
I'm wondering whether this category may include more
Yeah.
than the IEP group.
I think so.
This is just students with disabilities that are on IEPs.
They are,
Yeah.
okay,
Yeah.
that's good enough.
These are just IEPs, they're not the category, what do they call it?
504.
No. For the EFA program, it's,
So you could be identified as a student with a disability if you were in a district and had an evaluation completed, or you can be a student with a disabling condition,
Disabling
which was
condition,
identified by a doctor or another entity. Yep.
so we've gone from roughly 15% of our population to about 20% for the IEPs.
Yeah.
So there's a increase that, and those are just facts. Those are facts.
Right.
Representative Dry.
Thank you. So my husband and I were talking about what we remembered from when we first started homeschooling and those statutes and things. We talked about this. We remembered that after a certain percentage of IEPs in a school, there was a flag and an investigation. But I couldn't find anything on that in the statute, so I went back and asked the state librarian, where you can see reference to it in this book. It says it was repealed in 1994, but it doesn't say why or what it was. So I asked what it was, and this is kind of what we remember. It's 186C3, and it said, it used to say,
And
in
what
any,
year was that from? I'm sorry.
this is 1993 I'm looking at. In any school district in which 10% or more of the pupils are classified as educationally disabled, the Bureau shall study these districts and their special education programs to determine the reasons for the unusually high percentage of disabled students. It used to be 12%. They dropped it to 10 in 1987, and then it just repealed the whole thing in 1994. But that was the kind of the flag. It was not a penalty. It was just, this looks unusually high. Why is this? We'll look into it. So that kind of is what you look at. We've seen this number go up, but there is nothing triggered for any kind of investigation. This one was a very banal and neutral investigation. It wasn't looking for fraud or anything like that, but
Right.
just kind of why did the numbers go up? There might be a perfectly logical explanation for that, or there might be something that you can fix.
Well, as you get through some of these statements, I think we'll start seeing why some of this is happening. We had there was a question later on about this other health impaired, and Rebecca did communicate with us, and that's on number 9 under A.
So are we not going down sequentially here? Have we gone?
Okay. The other thing I want to talk about is learning disabilities are the most common disability type in New Hampshire. 35% of our kids have a learning disability. There might be, and there's ways you might be able to address this through early intervention. You have the 3-tiered program. You can have remedial reading teachers. You can look at how you're teaching reading. In fact, that was a recommendation that came out of Edunomics. I think that's their recommendation is on the last page. Yes, it is. On page 6, recommendations that came from that group. Improving reading instruction may help reduce referrals for reading-related disabilities and benefit all kids. How you teach reading.
The very last line.
B, given New Hampshire has some of the most heavily staffed programs in the nation, one option is to focus on quality over quantity of staff to better support learning while containing costs. New Hampshire special ed staff, if you look in all your staff, 27% are teachers, 26% are specialists, and 47% are paras. So they're basically saying if you can look at how you're teaching reading, maybe you can get some of the kids getting that support within that reading instruction. They may be more successful. That's another way of approaching it. Rebecca?
And I would agree. And that's why we have a program within my bureau that works with districts around their literacy programs. It's called Bridging the Gap in the 603. And it focuses on letters and the science of reading and teaching teachers how to be more, teach reading in a better way so that all students can learn. So that is something that's already being worked on in in the department, and we're looking to expand that. So it is something that we have recognized and we are focusing on.
And I sat in a meeting as a trustee for the university system when the commissioner came over and worked with those people in the education departments at New Hampshire, the University of New Hampshire, Plymouth, and Keene, and got the instructors there in their methods courses of teaching reading to integrate what you've just spoken to as required. So it's not going to be incumbent just on the local school district through their professional development to get new people coming in on board. They should be coming in if they're or going to school in our state.
And we're working with the Institutes of Higher Ed, the university system, to ensure that their staff is trained in the science of reading and that they're putting it within their syllabi for all of their courses for students.
Yeah. So I think that's one way to look at this disabilities and yes.
So you're talking about vertical alignment from professional development all the way down to districts implementing supports there. One other question I have regarding sort of this A7 area is around any of the early indications or data we are getting with our dyslexia screening. Do you have any ideas of how that is working because that just recently went into law, right? Was it last year before?
Why?
Pretty recently. Do we have any data on how that is going for folks?
Okay.
Yeah. Go ahead.
Oh, sorry.
Go ahead.
I do not have any data on that because that is not a special ed
Okay.
initiative. It is for all students to screen for dyslexia so that they can address it potentially without needing to go to special education.
Right. That's an early intervention.
Yeah.
How many, I remember passing that. How many grade levels are we doing that screening? Is it through third grade?
Great.
Yeah, grade 3.
Yeah, okay.
Yep.
Representative Dry.
So, I don't know if you read about the Mount Lebanon school where the deer went through the window.
Oh, yeah.
I have the video.
Oh,
Yes.
wow.
Well, that school actually made the news up in our area because Senator Hassan came to visit, and they used the screening to reinvent their reading instruction because they found so many needed to be screened. They said, maybe we were doing something wrong and or could improve things. And so they looked at, they picked up the LETTERS program and they put it through. This year, the third graders are the first ones that have gone all the way through with that program. But last year, their kindergartners' literacy benchmark went from 44% to 89% over the course of the year. They had spectacular results. And I'm going to go visit the school as soon as I can, once they pick up from the deer stuff.
And
It went from 40
we've seen that with the
4 to 89.
Yeah, we've seen the increase in the schools that we're working with.
But it was that screening that was the trigger because they said, how could the entire class need to have this? So I think anecdotally it's doing a good job.
So early intervention. Yeah.
Mr. Chairman, one of the things I know we were looking at the referral rates for categories and a couple of things that I've heard mentioned throughout these months. One is the increased rates for autism. Is there a correlation between that and the new DSM-5 in the last 20 years? The criteria changed. So we're identifying autism a lot more than we used to. And I think the other piece that we also heard with regard to other health impaired, I know I gave you some information on 80% of the cases that I handle, we have trauma identified for those students, adverse childhood experiences, is that we heard testimony from folks, other committee members who said that sometimes emotional disturbance children are identified as other health impaired because emotional disturbances is a pretty negative term, right? I mean, to refer to it that way. And so is other health impaired actually inflated, or they're just people in that category that should be in a different category? And I think we've heard enough to say that folks sometimes put the mental health kids in OHI and
the students with autism as well.
And the students with autism as well. And that's not fidelity, I think, Becky. Would you agree that you got to put a square peg in a square column,
I
right?
think the issue is that OHI is so broad that it can fall into that category, and that's why you have some of these pieces that they could go someplace else, but because of the way that OHI categories was developed and is defined, it's very broad in what can go into that category.
I agree, and I think that's something, because we were asked to really look at the OHI, I think that's something, I don't know how the committee feels, but saying that because it is such the terms of it are
Well,
so
let's-
broad.
Let's get
it's a
to that
catch-all.
because it's on the bottom of the page here, and it's basically, I took a quote right out of what Rebecca sent us. Just finishing up though, on dealing with the, let's see, the top part, in the
Right, A7, right?
well, I was going down to A9. You can, other health impaired, this is some information, 20% or that. But we'll talk about that at the bottom page. But number 9 here, see attachment, census of disabilities. When we know that from 2024, we're seeing gains, but there were some things changed in 2008 regarding deafness. And so, but using the broad criteria, growing awareness and reducing stigma has made room for less severe cases that likely would not have been diagnosed before. Some researchers and advocates have started using the term profound autism to describe cases among children with an IQ of less than 50, or who are minimally verbal and nonverbal. Around 27%, this is a national statistic, around 27% of 8-year-olds with autism in the United States fit that description, according to the most recent estimates. New Hampshire census data regarding this disability identify the following, and there's the number of kids which we have with autism now. Autism is spoken to on the next page too. The other health impaired on B here, this is a statement I took right out of an email that came to me from Rebecca. OHI
From Rebecca, which one?
Fredette.
Okay, oh, I'm sorry. I was wanting to make sure. Okay.
And as you just said, Tim, OHI can cover multiple impairments. And Rebecca, this is yours. Do you want to explain what you wrote here to me?
I think I had shared an article with you, so I'm not necessarily sure it's my language,
Okay.
but it can cover multiple disabilities because I think you listed some of it in here. I don't remember what page it's
on
on.
page
It's on
one
page 2.
Starts on
at
page
the top
1 and
of-
continues over.
So some of the things that were identified in the article were ADHD, diabetes, epilepsy, a whole bunch of different things, but only if it affects the child's educational performance. So it would not be identified as an other health impairment if it's not affecting their educational performance.
Yeah.
And that's different than their access to education. If it's access to education, it falls under a 504 plan.
Yeah, and see, that's what we have right here. We have down where it says, affect a child's educational performance.
Yep.
Yes.
Thank you. Ms. Fredette, when a child presents and they are an OHI and they have any of those conditions, and they're referred and you know, the staff wants to take a look at that child, do they still use the same metric from least restrictive to most restrictive? And what I mean is, do they start with the 504 and then progress to an IEP, or does it automatically go to an IEP?
So if this child is referred to special education, they go through the process of the evaluation, and we don't look at it, do you get one or the other? It's, do you qualify for special education? And if you don't qualify for special education, is it an issue of access? And do we need to look at, are you able to access your education appropriately? Because you're looking at two very different things. So they may not look at a 504 at all if it doesn't have anything to do with access.
And I have one more question
Yes.
for you, Mr. Chair. Mr. Chair, my microphone's not on, sorry about that. We're looking at the percentages of our special ed kiddos in the state, and there's a category that no one has touched on, and it's the last one on this very great graph, and I don't know who gave this to us, but it is
And that came
so
from Melissa White.
great. This one is so great. There's a category in the bottom that says 9 remaining categories at 24%. What are the 9 remaining categories?
Well, those, you have the 13 categories right here that are on the census. You can see them all listed down, but autism, deaf, blindness, deafness, developmental delay, emotional disturbance, hearing impaired, multiple disabilities, intellectual disability.
Yes, sir, but from what I understood, that would fall into OHI, or am I mistaken?
There are the specific categories. Are you on the front or the back of the document you referenced? Oh,
There's
on the
only
back.
the fronts. Right on the bottom, it says 9 remaining categories.
It's hard.
So if you look, yeah, because it's at the top, it's saying learning disabilities is 35% of the students. Other health impairment is 20% of the students. Autism, speech and language, so it gives you those 4, and then the other 9 would be deaf, blind, developmental delayed, emotional disability, hearing impaired, multiple disabilities, intellectual disability, orthopedic impairment. What else is on here? Traumatic brain injury, visually impaired. I think I got all of them. Yep.
Yeah.
So it's those other categories that are
That's a lot.
they have such a small number. And if you look at this chart that we had given you, it shows you how small like for visually impaired in the entire state, we have 85 students. For deaf blind students, we have 9.
Yeah.
Like they're really small categories, and that's why they lump them all together in that bottom, because they are such small categories.
I think the key to the OHI is number 2 on page 2. In advocating that a student is eligible for special services under OHI, you must prove both that there is a health problem and that is the health problem that is and that it is the health problem that is adversely affecting a child's educational performance. And it lists the statutory reference, the federal reference.
And I think that's, oh, sorry.
Yeah, and I think that who makes that decision?
The IEP team.
The IEP team. Are our IEP teams properly trained to know this and discern this?
You have a special education teacher. You have to have a special education teacher on the team. You have a LEA representative who is typically your principal or your special education director. And then there are checklists that they use based on the criteria for each disability. And then if you're doing speech and language, you have a speech and language pathologist. If you were doing autism, you may not have a medical doctor there, but you may have a note from a medical doctor that states that the child has autism. Other health impairment, you would have a medical note that states that. For deaf and hard of hearing, you would have a teacher of the deaf and hard of hearing. For a visually impaired student, you may have a teacher of the visually impaired. So you do have some of those expertise for those different disabilities.
Well, that gets down to my point. For example, if you're I'm sat at many IEP meetings. I always relied upon my speech pathologist, who was ASHA trained, ASHA qualified, and when that person spoke and was giving all the rationale for why this child has or does not have a problem, a concern, a disability, I listened there. I could hear other people sitting there, maybe it be the principal, or maybe it be a classroom teacher, or maybe it be some other person that doesn't have that expertise. You're reliant upon that one person pretty much for that expertise.
So that one person is providing you with the information they have on the child in relation to that disability, but then they would go through the checklist and all team members would have to agree with the disability to say, yes, we believe this child has the disability.
So when we're dealing with autism, that's a hard one. We saw that there's a difference between now profound autism and autism. Who's qualified on that IEP team to make that decision?
For autism, they would need a medical note stating that it is, because it is a DSM-3. I don't even know what number we're on.
5.
I don't even know what number we're on anymore. It's a DSM category. So.
And in my experience, my practice is normally the school psychologist is present with a child with that profile.
I just want to orient myself for the notes. Are we at A5 or are we somewhere else?
Well, we're
B.
We jumped in,
Me too.
there's sort of some linkage there between the two.
Thank you, sorry.
We're,
Autism is not.
between what students may be labeled other health impaired, that was one of our responsibilities.
Me too.
Going down from here, I didn't do anything. The increase in referrals since the COVID school closures, we haven't discussed that at all. And is there an increase in referrals or is that slowing down?
I believe when we had looked at the numbers, there had been a dip and then it was back up to pre-COVID levels. So we're back at pre-COVID levels, but it's continuing to increase. So it wasn't a huge jump right afterwards. It's been a gradual.
Okay, so that we'll have to be looking at. D, whether there are interventions that can be implemented prior to referrals. Well, we have the MTSSB, and I brought in a sample intervention policy that I used in my school, where we had the intervention team meeting once a week. And before you could refer to the IEP team, of course, you could go directly to it. But it's pretty well understood that we wanted to check all our bases off. And I was in a community where we had bilingual and we had migrant, we had all kinds of other issues. In fact, I even had community mental health on my IEP team or in the intervention team. And that was very, very helpful. And we found sometimes that the one that was making the referral was the classroom teacher who hadn't bothered to talk to the previous year's teacher to find out how you dealt with this behavior in the classroom. And that's not uncommon. Now, oftentimes you'll find the educators don't talk with each other. And the teacher prior year had more of a family environment and welcoming, and where the one that had this year perhaps was more concrete, sequential, line them up and no latitude at all. And so, and teaching styles were different. And that's oftentimes, not often, but we saw those dynamics, and intervention can make a better learning environment for a student oftentimes. And we did at times have to change a student from one class to another class within the school. So I think intervention, we all agree, intervention's needed. And intervention's a key to, I think, to even reducing some of our IEP concerns.
Mr. Chairman, I agree, but I think one of the things that is not utilized from what I'm seeing in the field is the Bureau for Children's Behavioral Health is usually brought in when it's a catastrophe. If they were brought in sooner, those interventions might be far more effective when a student is 7 or 8 than they are when they're 13. And schools are completely able to make those referrals. That's part of the whole fast forward wraparound program is a school can make a referral the same way. A parent can say no, but a school could use that as a tool. And in theory, at least, if those behavioral issues were getting support outside of the school, maybe they don't rise to the level of interventions in school or official, more significant interventions. You may see a kid that ends up with a 504 instead of an IEP because the services he's getting home that are covered by Medicaid are reducing the behaviors or teaching them skills so that they're not acting out at school as much. And I just don't see it used as often as it could be at those younger ages, because it truly would be more effective to work with someone at that age than it is once they reach the dreaded teenage years, right?
You get all that, Megan?
I think so. I was just wanting to.
I know.
No. I was wanting to make sure what I had heard you say was not DBART, Disaster Behavioral Response Team.
No, it's
Something
fast
different.
forward. It's the behavioral health, the fast forward program, the wraparound program. The schools can make referrals to those. I mean, the parent can obviously say no, but I mean, a good sit down at a parent teacher conference and say, hey, this program is available. Would you like me to make a referral for you? I just see it as if we do it, what we know about any kind of condition is if you get it sooner, it doesn't get as severe, right? So I don't see it often. And until we get to the teenager, and now we're looking at an episode of treatment, which is expensive, disruptive, everything.
May I, Chairman, may I ask a question to Tim? So with that, how much of that component that you're noticing in a trend might also be, needing some more funding for the program to educate folks, to let them know that that's out there, or to ensure that that is continually something that is kept top of mind for folks?
I honestly don't know that the program needs more funding as much as I think that the school districts could use a little bit of outreach that says, hey, did you guys know you can just go to this form and make a referral that way? I liken it to, for example, here's my give props to Rebecca and Deputy Commissioner Sala. We had a lengthy problem with people kind of saying it's not my job to make the referral to Voc Rehab. And it is.
Yes, it is.
And both Rebecca and the Deputy Commissioner put out a really nice informative memo last fall that said, hey guys, while anyone can do this, you should. And guess what? More people started doing it, and you can do it right from the table while you're in the meeting. And I just think it's the same principle. If we could get that in, and if they had the outreach, earlier is better.
It's also the referral to the area agencies. It's not just the referral to the VR. It's also the referral to the area agencies for those, to get those wraparound services. But that varies from region to region depending on your area.
And I would think a school social worker, any district that has a social worker, that would be who I would say to key in on that.
Just a question for Rebecca. So since we have Child Find all over the place, and they do early intervention, I know I was very fortunate to have them when we moved up from Massachusetts and my son was 3.5, and he's on the spectrum. So we went through Child Find for his early intervention, and wouldn't that be an appropriate place to start that process, such as Tim had stated, if there's going to be issues of that kind? Usually with and at the kindergarten level as well, everyone gets on board with half day or full day kindergarten. Wouldn't that be an appropriate place to introduce something like that can be, taken care of while the child is young and able to learn appropriate behaviors than waiting until they hit middle school and hormones and ugliness and
Yeah, so we have Part C, which is with Part C for IDEA, which is with DHHS, and that is for birth to age 3 students, and they can be referred and receive those early intervening services then. And then we also have preschool special education, which is for students from 3 to age 5, not in kindergarten.
Right.
And it's not required in the state for preschool, but we do provide funds to districts, and they are required to do Child Find and find those students and provide them with those services for special education.
But, and follow up to that, Mr. Chair? Thank you. But even if they don't access that type of help through the district or through Child Find, more than likely, those families have either private insurance or state issued Medicaid. They can still access those services with those insurances. Is that not correct? I mean, I think we need to open up the umbrella a little bit and say, you know what? We may not be able to supply it to you at the district level or the Child Find level or the early intervention level, but here's a resource for outside of this catchment, so you can get what's beneficial for your child at this time. Kind of working simpatico with outside entities as well as inside the districts. I mean,
Absolutely.
That's how I was able to access as much as I got for my son, is I didn't just stick to one entity. I expanded my scope. I said, you know what? They can offer me A, but he needs B. And I'm not going to depend on them to come up with B. It's really kind of my job to do it. And I was fortunate enough to be able to dig down on that stuff, find it. But some people don't have those types of resources. So, I mean, maybe expanding the umbrella a little bit so we can make sure that parents know what their options are instead of being, all centralized. Just an idea.
Yes.
I did have a question too. In thinking about what Rep. Freeman was saying as well, with some of the changes that we have with regard to the home education reporting and things like that, data, does that impact the ability to have access to Child Find information if folks aren't reporting that information through home education? I'm just curious.
I think, I'm not sure I'm clear on your question, but for Child Find, they're not supposed to just look for students that are within the public school. They're supposed to reach out to doctors' offices and community agencies and area childcare centers. And so you're supposed to be you're literally looking for the children. So you go to places where children would be, pediatricians' offices, things like that that are in your community. You should be reaching out to those and saying, here's how you can refer a child, here's how you can reach out and receive services.
That's really what I was asking. Thank you.
And are those services now, I have a daughter who is a speech pathologist down in the Myrtle Beach area, and she does Child Find. And she enjoys working with those kids who are 3 years, 4 years old. Is that done through the school district or is that done through the doctor's offices? I get the inclination that is separate, that she's being paid through some other entity other than the school for that service.
So different states do different things for Child Find. Some people put more funding, some more of their special ed funding into a more centralized Child Find type of program, but it is the responsibility of the districts for Child Find. So each individual district has to have a plan on how they will find, identify, and evaluate students with potential disabilities.
And that's also their financial responsibility too?
Yes.
Okay.
Okay. Okay, we went through D, which is the intervention stuff, the MTSSB. And by the way, when I had my intervention team meetings, I had a member from Community Mental Health as a permanent member on that. And of course, I was also a trustee for that organization. And so it made it easier, but I provided a separate room within my building for the counseling to go on, so that we oftentimes bypass the IEP process by going through the intervention process and getting community mental health involved directly, and it was not really an academic issue. Their education performance was being hammered by their behavior, but by having the counseling going on in that room with parent coming present and being there at the same time during the day, eliminate transportation problems and all. So that really worked well for us, but I don't know if everybody has that capability. Jumping down to E here, can you, Rebecca, medically necessary, you wrote this language right here. There's 3 short lines there.
So medically necessary is a literal checkbox in the New Hampshire Special Education Information System. And the only purpose of that checkbox is to say, this is something that you could apply to Medicaid for. This is all on the districts. This it's not a term related to special education services. It's not anything that we oversee, that we put the box there at the request of districts so that they can just identify that, yes, we're going to track a paraprofessional because we believe it's a medically necessary service and we can apply for Medicaid for that
So
service.
how would District A administer that? How would they communicate that with parent or with classroom teacher, or how does this occur? They got to check off something.
It's just on the IEP. So if they have
Okay,
speech and language services, it's a
So you have to have a
checkbox.
referral first.
Yep, it's only if they actually have an IEP and
Okay.
they've been determined to be eligible, the districts would check that off so that they know as they track services that they could be submitting for Medicaid for that service.
Any more on that one?
And they're not required to, correct?
Nope.
But they could. Yeah.
Okay, item F. There's a lot of stuff I threw in here. I don't think we need to discuss it, but item F, and it'll probably come out. I just threw stuff in because I was doing this late at night last night. and
That's the
this-
subject of a book, you know.
Yeah.
Yeah.
F is a comparison of the processes, requirements, and services under federal IDEA law, state law, and the rules of the Department of Education. We have in statute, that part right there. This is right out of statute. It was modified within the last year, I believe. We modified that. I wrote the darn thing. 186C 16C, rules exceeding state or federal minimum requirements. We exceed here in this state. And there's an annual report that comes out showing where we're exceeding, and it explains all the components which that are exceeding the federal minimum requirement. Now, we do have that What the concern that we had as a legislature was when we do exceed in our rulemaking, are we creating an unfunded mandate for the school district in the process of exceeding? And we wanted to be aware that this rule would cost money. That's the basic object of this. I think that was put in. Yeah, it says, if the rule exceeding state or federal requirements may have an indeterminable fiscal impact on the school districts and reasons for exceeding those minimum requirements. So that rule has to explain that there are going to be some costs. So I think that we go beyond in this state.
And we post on our website a chart of all the rules and laws in excess of IDEA.
Now, do you have some examples, Rebecca, where you exceed as to why we do exceed?
A lot of, honestly, a lot of it is providing parents with more rights and providing them with more options. 14 days to sign an IEP, must receive the IEP 5 days before you have the IEP meeting. Those are some examples of things that are in there. So it provides more information for parents. I would, without having it in front of me, I would say most of them are providing parents with more supports.
If you go on the web, that's exactly what it says. Yeah. Okay, going down then, I don't know, is there anything else we should add in there? But regarding IDEA law, state law and rules, I'd like to have IDEA pay us what they need to pay us.
That's a good point to put in.
We ought to put that in there.
Or investigating a waiver.
Yeah, yeah, because the costs are just climbing.
If I could make a point, Mr. Chair, there is not any federal regulation on the books that a state cannot find a way to apply for a waiver. And I think at this juncture, it may be worth a little bit of time digging into. We're bound by a set of rules and that is, it's crippling us. It's crippling, our financial well-being on the local district level. It's certainly not doing what it was intended to do, and I think it might be worth it just to look into see, is there any recourse to this and where we can go. Rebecca, I know you're going to tell me.
I just had a clarifying question.
I also had a question for the record too.
Yes.
So,
Are you saying a waiver of the requirements of IDEA?
Yes.
okay, that was my question. If it was like a specific rule or specific federal statute, or if it's all of it in total.
I'd like to add to, I think we have some very dedicated, extremely knowledgeable people at the state level. And Rebecca, I'm including you in that, who know what special education is about. And I have full faith if we were ever to be fortunate enough not to have to go by the rigid and very expensive rules of IDEA, that this state would be able to rise to the occasion and develop their own special ed standards.
So what are you going to do in because I wrote legislation like that years and years ago. It was fun presenting it, but it was a joke on the floor. The final vote was like 60 for it and the rest against it, because we would have lost our federal money,
Well, if they're only paying us 5%,
$50 million.
I get that. But, it's, again, is it more expensive to follow their standards? Is it more expensive to follow the standards that we set? So it's a big nut. It's not going to happen overnight, that's for sure. But you'll help me.
Oh, yeah? Yeah, there's 49 other states, and are they in the same boat we are? Yes.
It's Mr. Chair, I appreciate the fact that you did at one time submit this type of legislation. I think it's not going to be something that's going to happen overnight. But I think it's definitely something that warrants some attention. We want to supply for our children. We want to make sure that these children get exactly what they need. But on the same token, we don't want to be breaking the backs of the taxpayers. So I just think it's something to look into. Just my personal opinion.
Dick?
Yeah, sorry. I guess I see it differently, very differently. I think if there were to be any request for any kind of waiver from the federal requirements, it should be preceded by an analysis here at home that identifies just where some people think, or where the legislature, let's say, thinks there are activities or services, programs that we're providing that don't need to be provided, and we're being pushed into it by an unreasonable federal rule. Until you have that, it would be foolhardy, for one thing, to go forward with a request for a waiver, and I think totally inappropriate, because you may be undermining services that are very important when you do zero in and look closely at what's going on. So I don't think we're ready for that. That's what I would say.
May I respond?
Yes.
Representative Ames, I appreciate that, and naturally, this, again, I'll say, this would never happen overnight. It would need a deep dive. It may take a year, it may take 2 years, but I think at this juncture, 50 years we've been doing this. It's not gotten financially better for us, it's gotten more burdensome. So I would say that at this juncture, it's not going to be overnight. I think anybody who wants to look into this is going to have quite a bit of work to do. So that's all I'm saying. I know it's not a knee-jerk reaction, that's for
No,
sure.
okay, fair enough. I just wanted to add that this, what we're talking about, which is the federal aspect of our special education system, brings me back to the federal funding issue. And for that, we've talked about the senator and the congressional representatives we have pushing the issue. It's also state level. So the governor needs to, I would say, be pushing this along with the cohort of governors around the country who also are not receiving their share of special education funding. And, it's becoming so visible that maybe there's something there, maybe politically that would be a good result from a hard push.
Right, I agree, Representative, and that might be the end result of looking into this, which avenue should we take in order to address this?
Yeah.
Thank you.
Yes.
Thank you, Mr. Chair. I think also to Representative Ames's point, I concur with him, and I also agree that I think these are also, when we're talking about exploring this concept and the lack of the funding, these are actual choices at the federal level that are being made. So when we're choosing to do something like put money into the Farm Bill for SNAP benefits, or we're putting money elsewhere and not putting it in special education, that's coming from somewhere. It's not just, that is an intentional choice elsewhere. And so I think that I agree with Representative Ames. Before we would move any other direction, we would want to explore completely advocating in those ways that we can. It is not just unique to the state of New Hampshire.
I understand that.
Yeah. So I
understand
appreciate your input. I think we disagree on where we might need to go right now. I think that IDEA is a protection for learners so that they can go anywhere across the country, including our military families who might have students with disabilities also. I think that it's there for a reason, because there's historical precedent of there not being protections prior to 50 years ago.
I think there's another aspect to this too, and I agree that that we need to look at and do look at and do some analytics and all that on it. However, there's also another issue. We have 109 SAUs in this state, and our structure and organization of school districts are within these SAUs. We have some now that I have 1, 2, 3, 4 within my district where there's less than 60 kids in each of those districts. And they are required to provide these services. And unless we figure out how we're going to assist them in delivering these services, just in understanding what they have to deliver is, difficult for them. One district, they can't even find a PE teacher now. That's under 50 kids. And that's town of Warren. So I think that we're going to have to look at, is there another way? And we heard Henry Lipman talking about the school district out in Colorado that has this responsibility for helping to manage the special education services for those districts which are unable to do it themselves. That they call them the Board of Cooperative Education or something like BOSSI. And I've always been interested in that concept. These small districts, unless they unify and become one district, which they're trying to do over in Vermont right now,
Yeah.
and they've been trying to do that for decades. And each time they've done it, they found out their administrative costs have increased. So it's a very perplexing issue. And I do not like the way the SAU bill we had went about it. That was just like, jumping off of the cliff and not knowing what you're jumping into. But we do need to look at it, the organization structure of these units. Some of them are so small they can't survive and provide these services. So but they're still underneath the mandate to provide them. So I would suggest somewhere along the way we need to look at some kind of a plan to provide these special education services, training, management of resources to them. They don't have the same administrative staff that some of the districts like Manchester would have, or a larger community like Nashua or Salem or Portsmouth or Hanover or Lebanon. They're small and they just don't have those. They oftentimes have a manager or a superintendent that's not as experienced as the person that's driving the ship elsewhere. So that's my 2 cents right there. I think that's another part of the equation. So jumping on down here into G, the local school district reporting especially costs to the Department of Education. 1563 has a component in there, and of course Rebecca has also given us at our last meeting all those rules. What the ED 1129 was it, or I can't recall it, which are very thorough.
1129.
1129.
Yeah.
Yeah, rate setting, but it has a lot more than just rate setting. You get to the end of it, you're talking about hearings and legal stuff and that, and then you get in between. It's somewhere along the way here. I think I referenced those in here.
Mr. Chair, if I
Yes.
It's my recollection, Rebecca, that initially we were talking about certain things that we don't set rates for, and then there's certain things that, generally speaking, we don't have outside provider rate setting. And that was something I think a few meetings back you had indicated that perhaps the department was at least open to exploring that concept in some way.
It has been discussed, yes, and we are limited to setting rates for what are considered our private providers of special education. There's 25. Sorry, we've added a couple, so my numbers might be off. But we set their rates for private providers, and that includes their tuition rate, their speech and language, their OT, PT, counseling, and paraprofessional rates.
But aside from that,
we do not set any other rates. We don't set transportation rates. We don't set rates for speech and language from outside providers. We don't set rates for anything else.
Can I ask-
Yes, Representative Dry.
When you say you set the rates, is it equal across the state, or you set them for the particular areas?
So each private provider must submit a rate setting application each year, and it has all of their financials in it. I'm not a financial person, so I'm going to give you a broad overview. It has all of their financial information in it. It talks about their expenses, their revenue, their everything, and then their staffing, and then we go through it and ensure that they've completed it correctly. And then from that application and that documentation of they do an audit each year from that audit, and then their 6-month actual costs, we determine what their rate is for the next year. They make a request, we look at it, and then we say, according to your information, we would say that your rate is here, and then we give them either stay the same, go up. We don't ever go down, but we either stay this unless they ask to go down, stay the same or go up slightly each year.
Follow up.
Yep.
So you're saying the providers,
The providers,
the
yes.
providers are different across the state?
Yep. So Easter Seals is a provider. Spalding Spalding Family Services is a provider. Mount Prospect, which is a company of Beckett, is a provider. We have, like I said, we have 25 of them. Yeah, and they all have different rates based on their costs. Some of them are residential, some of them are day program, some of them take different needs, some of them have medically involved students, so their costs are slightly higher because they have some of those medically involved students and they have to have LNAs and other pieces on staff. So it depends on what they're providing, it depends on what their costs are, and what kind of service they provide to the students.
Okay, thanks.
Yep.
So what are reasonable costs? That's in 1129.
That's a great question.
That lawyer term reasonable. On page 6, you can see the categories of,
Sorry, can I ask a question on 4 and
Yeah.
into 5? Has
Page 4,
page 4, has 1563 has passed and been signed?
they're not signed.
right.
It's passed the House and passed the Senate.
It wasn't amended, so it can go right.
It went directly to the governor's office.
So, this is a kind of a day-to-day kind of, I guess, question or comment or whatever, but 1563, I think, is going to make, and maybe that's its intent, is going to make a number of more students eligible for state special ed aid because the threshold is lower. And the majority of those students are going to be students that we have in district. And I think what we're going to need to submit for in-district students, if it's anything like it used to be, we haven't submitted for many in-district students because the threshold is so high, is going to be pretty involved for our staff. Now, to submit for state special ed aid in general is a long process. Like our staff, we have 2 staff members who do it. We basically remove them from the SAU office, put them in a conference room, and that's all they do for maybe a week to make sure that they get everything in. So back to your comment about the number of SAUs, there's going to be SAUs that's problematic for them now. And it's going to be more problematic for them now that they're going to be submitting for more students, or at least should be submitting for more students. So that's kind of a comment, I guess. And then one of the things for in-district students is we have to, my understanding, unless this is going to change with the rules on how we do it, we basically have to invoice ourselves for in-district students. Mm-hmm. We have to create an invoice for, let's example that this student gets, has special ed teacher services, maybe a shared para, speech, and maybe some OT. We have to basically create an invoice billing ourselves to submit to the DOE system for each of those services. So for that particular student, my example, we're going to be creating 4 invoices for that in-district student to be able to put in for and be approved for state special ed aid. Does that make sense?
You can do one invoice.
Can we do one now?
If it's all from the same. We look at it as an invoice, and it's all from this, like when we get an invoice from Easter Seals, they put all of their services on one invoice. They put on their tuition, they put on their speech, they put OT, they put the para, all on one invoice.
So we can do that too?
Yes, you can.
Okay, good.
Including transportation.
If it's all
Yeah,
from the
yeah.
same.
If it's all the same IEP.
Well, we'd have to probably do transportation separate because we contract it. So if there's any contracted services, we submit, but we'd submit those in the same way. That's more of a,
And the only reason I know that is we do have some districts that do submit some costs for in-district students currently, and that's how we do.
So Dwayne, on your transportation, you're saying you may do that separately from, but it's still an IEP cost. It's written in the IEP. So wouldn't it be an invoice which is included within?
yeah, so in my example, we're going to create if it's an in-district student, so let's say that student did have transportation to our own school, they live
Yeah.
in town and they go, but we may contract that service out because we don't have our own buses in one of our districts. I'm just suggesting we would be submitting a separate invoice for that same student because it's coming from a company.
So if his district were providing the services through their own
Yeah.
bus drivers,
Yeah.
then he could put it on his invoice. If they contract with somebody else, they would provide us with the invoice they got from that
For
company.
that particular student.
Yes, for whatever company they
That-
contracted
yeah,
with.
I understand that because most SAUs are probably contracting that service out. And doing it all kinds of costs. The costs are going to be all over the board.
Oh, yeah, and in some examples for us, the transportation cost is higher than the educational component now. You know, we have some students for, in our two districts that it's 500, 550, whatever a day.
Yeah.
Transportation. So if you do that, you do that for 180 school days, it's 90,000, 100,000 in transportation costs, where the educational program might be 60 or 70.
Go ahead.
That's a pretty shocking statistic there. And I'm curious to know, in addition to obviously those other rates that are out there, changes like in gasoline and things like that right now are also perhaps changing the rate that you might be given. I don't know. I'm asking.
Yeah, so we're doing, and this will be universal for all, whatever, 200 school districts or whatever. But I mean, right now we're doing those contracts for next school year. So we kind of know, okay, we know that kid's still, unless the student moves, we know where that placement is. We know the end of the year IEP meetings are taking place. So we know where those, contracted places are. And we're contacting the 4, 5, 6 different transportation companies that we use and getting their rates and kind of locking in those rates for next year. And so, yes, there's no question that those rates don't go down. They pay their people more, cost for vehicles, gas is in there, profit for the company. I mean, those kind of things. So, we try to do as much as we can in district. Bo owns their own transportation fleet, but those trips that we're making to wherever are not something that we can do, internally. So we have to contract those.
That is a huge issue. Yeah, I heard from some folks I talked to where their transportation costs are well over $125,000. Well over. And
I mean, it's just a really localized example, but other districts are doing this, and you may represent some of those districts. We have a very small district, one of the districts I serve. Literally tomorrow night, we're going to the board to ask approval. We've done the legwork to buy a school bus lit 7-passenger van so that we can do some of these trips ourselves because of the cost. But what do you have to do for that? You got to find a main driver and a backup, place to maintain it. Where are you going to fuel it? We've never had vehicle insurance in that district. Where are you going to park it? I mean, there are all these little internal things that you have to figure out, and that's our job to do that, and we've done that. So we're going to ask to do it. And it's just this leap of faith that this district, Dunbarton, has never had a district-owned vehicle in the history of the district. We don't own one vehicle. We don't own a truck. We don't own a lawnmower. We don't own anything. But because of this, what's going on, we're going to make this leap into the unknown. But it's also long-term. There's no way that it doesn't save the district money. There's no way. You just have to figure it out.
Representative Freeman.
Thank you. And
Save money.
It doesn't save something. I mean, we've got the upfront cost of the vehicle. So in year one is the year that we would break even, hopefully, or maybe save a little bit. But then down the road, it becomes this thing that you just don't have to contract.
I have a question. Maybe Rebecca, you can help me with this, and Dwayne as well. Do you have a breakdown of the diagnoses and if they're being supplied transportation or not? Would you know, like, what are we looking at here? Look, I'm going to be frank. My son on the spectrum, never once did I put him on that bus. I quit my full-time job to do it, and I'm not saying that there are a lot of parents that can do that. I transported him every single day back and forth, middle school and high school, because at the time Manchester, and still does, only has one autism program through the whole district. So we lived on the east side, the programs are at West High. That's what I did for 6 years. I picked him up and dropped him off. But I'm just curious to see what we're looking at as far as we have to supply transportation. But we already do supply transportation in the form of the other buses. So I'd like to see what exactly are the diagnoses that are going with the transportation. There are some children who are never going to be able to be put on those big school buses. I understand that. But I would like to see what that looks like. I would like to see what that looks like. There are some children who have medical needs. They may be in a wheelchair. They may be compromised as far as mobility. They'll never be able to utilize a regular sized school bus, but I'd be curious to see what that looks like.
I think for us, the vast majority of our special education transportation costs are students that don't go to the resident school. They're out of district placed students that aren't in a residential placement. So they have to be transported. Now, once in a while, we'll have a parent that will do that transportation and we reimburse at I don't know if it's a state policy, but we'll reimburse at the IRS rate. Oh my gosh, that's a huge savings if you're just talking dollars and cents.
I'm owed some money.
But in district, we do almost all of that transportation ourselves.
Right.
And my experience is most parents want their students, if they're going to access district transportation, to be on big school buses with their peers. And I don't know.
So in your instance, it's out of district placements.
Yes, absolutely. 100%.
Got it.
I mean, not
Very
100%, but very much.
Largely.
And
out of
then
district.
you touched on the in-district students that are accessing specialized transportation are doing so because they cannot ride
Right, exactly.
a
A
regular
sized
school bus,
right? It's not, it's not equipped for that.
Right.
It's not equipped for that. So naturally, we would want a specialized, wheelchair accessible van or a lift or,
And for some districts that contract transportation, we're fortunate. I mean, one of the benefits to having your own bus fleet, there are some drawbacks to it, but one of the benefits to having it is we have some small buses, wheelchair accessible buses, that we operate, that we do our internal transportation with.
Right.
For a lot of districts, they have to contract that too.
Oh, sure.
And that can be, this big expense that people will look at and go, well, we're not even leaving town. How can it cost this much? Well, that's what it costs.
And one more question about that, Rebecca, if a child, if a child has Medicaid, the transportation costs, are they being billed to Medicaid? Especially if it's medically necessary.
We put everything into Medicaid billing.
Okay.
And that is we have people in our office that do that, the same people that do state special ed
Right.
aid billing.
Right.
But we calculate an internal Medicaid special ed cost for the transportation we do.
Right.
Obviously, the bills are right there. So yeah, we try to bill for everything that we can, and
But you can't bill private insurance. You can't bill private insurance.
It is allowed, but there are
allowed.
parameters around billing for private insurance. It can't increase their deductible. It can't decrease their lifetime eligibility. There's a whole bunch of parameters around
Of course there are.
so that you're not impeding the family from their access to their own insurance. Like, you can't do anything that's going to limit their access to their insurance, basically.
Thank you so much. Thank you.
And may I follow up?
Yes, yes.
In the event that something comes back when you're, this is a question for Dwayne, maybe. In the event that when you're trying to bill for Medicaid and you put things through and they come back and they say, well, we'll cover these things, but we're not covering this, then do you pursue a different billing avenue, or how does that work?
We're not even told that.
Oh,
We
okay.
don't get told that.
Okay.
That goes back to my comment earlier where I said they submit and they don't know what they're getting. If I don't know if I'm getting it for Johnny or Sally, I don't know
Okay,
if
so
I'm
that's
getting
what
it for
it's not.
transportation or services or like they don't know those pieces.
Yeah, and then, I mean, our staff does a lot with that, and obviously this, we've all heard that the Medicaid system is changing, so we have a bunch of people going to training on that and how, we have to kind of do that a different way, so hopefully that, that continues.
Mr.
Okay,
Chair-
so go
Yeah,
ahead.
I just want, just a quick comment, very quick. I'm glad to hear that Bo and Dunbarton are doing the Medicaid billing for this stuff, but we know that that's not happening statewide, that there are a number of folks who just have told us it is entirely too burdensome. We just, basically, we eat the cost.
Correct. There's a number, I mean, we talk about it a lot at our, our BA meetings, our statewide BA meetings, that, there are a number of districts that don't put in for Medicaid. And my fear too, part of it is, it's some districts that to be frank, I think should, but there are some districts that are maybe just, or SAUs that are just maybe too small and they don't have the staff to do it. It's a lot of work to do it. But for us, it's 6 figures worth of reimbursement. I mean, I think I just looked the other day, I think we're at 130 and we'll probably be 150 in Bow by the end of the year. And it's not quite 20,000 in Dunbarton, but it's something. So, it's time, it's work, but you should do it.
Okay, we've got to run through this G quickly here. We are requiring school districts to do this now with 1563. If you look at down on page 3, under 1563, and we've had this discussion. C, the district shall demonstrate and document that it is fully accessed to the maximum extent possible other available revenue sources, including Medicaid and private insurance, or provide documentation as to why other revenue sources were unavailable to the district for special education aid. Other available revenue sources, including Medicaid and private insurance, shall be applied by the district as offsets to reimbursable costs for each special education cost reimbursed through special education aid. And it goes through, and there's a documentation process, there's a monitoring process in the bill now. And so this is all coming at every district. And I understand the transportation is a huge problem, not just for special education aid.
Every district.
It's for all transportation. This is, take what you're getting reimbursed for a career technical education and run those kids back and forth to the regional center. You're getting reimbursed at 10 cents per mile. And if you allow the student to drive themselves, they get 25 cents, big deal, and per mile. That has to be board approved. And I watched the school buses going by my house today on the way up to Woodsville. I couldn't count more than 3 or 4 kids on a 66 passenger bus. And this is why you're seeing places like Warren and Piermont buying the small vans right now, and we're using them. So this transportation is a huge issue. Is there a transportation supervisor at DOE of any kind? The answer I was told was no.
No, not that I know of.
That's
no.
right. And so every state that I've worked in before has had somebody in charge of transportation, because you're dealing with all these transportation agreements, whether it's for contracts for a student or whomever it might be. And some districts own their own buses, as you may. Others are contracting, and those contracts are going up and up and up. And
There is a person in charge of pupil transportation at the Department of Safety.
yes, yeah, safety, not
Yeah,
DOE.
not
though.
DOE.
Yeah, that's right. Yeah, they come up and make sure you got the lettering on the side of the bus the right size, and they fine you $1,000 a bus until that happened to us. And it was crazy. And the gal that did that to us found herself working the other end of the state because, you know, Ray Burton didn't like it. So 1563 spoken to under that G in a number of places. The whole bill changes the monitoring and the administration. And if we see reoccurring issues in the district, they can come under scrutiny. This is the bill which went right to the governor, so I wouldn't be surprised if something comes out of it. Do you want to take a break here?
Yes.
Yes, please.
Yes, I think everybody's,
I need to stretch my fingers.
okay. So do you want to take a break for lunch and come back and try and wing some of this up? And then I think we are going to have one final moment on the 18th to try to consolidate what we're talking about here.
Okay.
So we'll need those minutes too.
I will get them to you like I have immediately.
On the 15th,
Oh.
excuse me, the 15th.
Second, yeah.
On the
I thought we were
15th.
talking about, we both have other state meetings that,
On the 15th, could
Yeah.
we meet at,
What time do you think in the morning?
at,
this one's gonna be.
It's at
Meeting because we're trying.
10 o'clock, but we could be done by 11:30. So we could have 11:30 to,
That crosses with yours.
So my meeting, I'll just look, it was noticed for,
oh, we could do it another day too.
I'm looking, sorry. Let's see. Where's the calendar?
You know, Dick, what bothers me a little bit, we're doing all this
Oh.
and we don't have the performance audit yet.
Carson, Senator Sullivan.
Okay, we're back at our work session here on SB 57, and we have been going through the tasks, the responsibilities given this commission, and we are on item H, the local district costs for out-of-district placement, and if other options were available. The local district costs for out-of-district placement. It's kind of a mixed bag, isn't it? Because you've got the state costs and the local costs. What are the local costs for out-of-district placement? I wrote in what we have for 1563 there and indicated that 1099 is going to be looking at this, residential placements. District. The local district costs for out-of-district placements, are they talking about, their education costs, right? Education associated costs, which would be labor, which would be transportation, if it's in the IEP. Is board and care part of the education, Rebecca, a cost of the local or the state?
If the district places the child in the facility, then yes, it is part of the cost.
Oh. Okay. You see, item number 3 underneath H, it talks about the committee shall look at funding sources and service costs associated with treatment, education, board and care, and costs to receiving districts. So some of those board and care are those costs which the receiving district the receiving district. Would the sending district,
Where are you right now?
I'm on page 5. On page 5.
3, 5, 3.
I think the language is slightly misleading because there is no receiving district.
Yeah.
It's just the resident district and then the private provider where the student would attend. There's no receiving district.
Okay. Take that out. So is there anything else we should add in there? I don't really clearly understand what they're looking for in this question or this statement. We don't have to answer everything either,
No, you don't have to.
Yeah, I think that we don't want to get hung up on minutia.
You've got the reference to 1099, that's important.
I think that's what we need, is the reference to both 1563 and 1099. That's the key.
Yeah.
Okay, let's go on to I. The analysis and effectiveness of local district developed dispute resolution options. I don't know if we want to get into this dispute resolution. You've got this report right here, right, Rebecca?
Yeah.
Right. LBA just did it.
Oh,
Oh,
do we get copies?
That's the
The 2024.
Yeah.
I was gonna say, we're still waiting on.
No, we haven't gotten that, but this is dispute resolution.
Right.
Part of that?
I provided you part of it at the last meeting, yes.
Yeah, that's right.
And there's recommendations. See State of New Hampshire Department Dispute Resolution Process, Performance Audit Report, March 24. Recommendations are in the area of the summary, the management control, regulatory framework, and performance and enforcement. The commission reviewed observation number 8 that we did the other day, obtained an understanding of costs, develop financial controls. The department will assess the need to develop additional internal controls and update to existing policies and procedures relating to the following: contract development, identification of fraud risk, improper payments, ability to recoup costs for any identified improper contract payments, and contractor payments in the appropriate state fiscal year. That came out of the report. Observations 13, 14, 16, and 17 containing recommendations reference local district dispute resolution, planning, monitoring of, procedures, safeguards, staffing, training, development, all those things are in there. I don't think we need to get down in any more of this. It's already there for you, Rebecca. I think we ought to just say, see the, dispute resolution report, LBA, audit report.
Somewhere in there, there should be a note that referring to the pending audits, the audits that are in,
Oh, yeah,
in, in.
Is that looking at dispute resolution? Well,
Dispute resolution.
Yeah, I don't know.
see, this one, I don't think they're going to look at dispute resolution because they've done that. And this particular question is dealing just with that. The analysis and effectiveness of local district developed dispute resolution options. What does the local district do as an option to going formally with the state?
This does not come out of my office, so I'm not sure. I know that they will go into agreements with parents outside of the
Yeah.
special education process and make agreements with them.
Yeah. We could put a sentence like that in there. Got that, Megan?
can you repeat that actually? That the report from the LBA,
Reference that.
The report from the LBA referenced agreements between districts and parents outside of the dispute resolution, the formal dispute resolution process.
Yeah, that's good. What do I have there? J, the use of state funds to provide services. Well, we have those sources that I put on the top of page 6. Special education aid, differentiated aid, IDEA, and this local education costs. Where else would money come from? Is episode of treatment separate from special education aid? I thought that,
Episode of treatment funds and court-ordered placement funds are separate from the special education aid funds.
yeah. It's in the same section of law.
Yep.
There's
it's-
like $250,000 available for some district that needs it in there.
Oh, in this, yes, there is language
Yeah.
in the special education aid section that talks about $250,000 available for small districts and $250,000 available for basically emergency fund. However, the way that special education aid funds are built, we don't know where to take it from. We've worked with Liz Brown to try to figure that out, and because the money that we work on starting July 1 is for the 25-26 school year, so we can't take $500,000 out of last year's money. But then where do I take the money from? Do I hold off $500,000 from the special education aid I put forth? So we aren't able to do it.
Then it's no use.
I can remember when we put that part in the law, Mr. Jeb Bradley, and it was a compromise to get something else. So that's the way that worked. So I wouldn't worry about it. I think having those 3 primary sources in there is fine. And then we could put, the other category that we talked about here with the episodes of treatment.
yeah, I was gonna say, do you want episode?
Yeah.
And court-ordered placements.
Yeah,
So the episodes of treatment and court-ordered placement money doesn't go directly to the districts, it goes to the providers, but it is for special education.
Okay. Medicaid to Schools program. I was hoping we were going to have people here today. We didn't.
So back on J,
Yeah.
just trying to understand this. This is current, you're really trying to lay out current law, which is all you're speaking to here. Differentiated aid for SPED is $2,185 per pupil. I guess the date there is, what's the date?
That was taken from the April 1, 26 data from
What is it?
DOE.
Well, I think just to sort of underscore that that's what current law requires. Current law requires, what I'd like to see in there is some statement about these amounts cover only a portion of the total cost.
Yeah, see, that's what I put the LEA costs, and we could put that amount down there. It's 85% of the total expenditures are paid by the school districts.
Yeah.
So if
yeah,
you were to
that's-
take 85% of 977 million, you could come out with those costs.
Yeah, that captures it. Maybe you can spell it out, the 85%,
Yeah.
what you're talking
Yeah,
about.
I'll put the dollar figure in there.
Yeah.
Include $8.
Okay, got it. I think that will show the picture.
Yeah, that's right. That's what I was
Yeah.
after.
Because I think, if I may.
Yeah.
I think that will speak to, obviously the lion's share of this is the burden of the local district. And I think that's what that's trying to get at in that LEA cost.
Well, maybe, maybe you should hook it, you may not want to do this, but that hooks back to the property tax question that you pointed out. There was, under this SB 57 responsibility, revenue sources to reduce the reliance on local property taxes. So 85% of total expenditures are borne by LEAs, most, if not all of this, coming from local property taxes, just so it's
Yeah.
identified.
Okay, I got that.
Okay, I noted that. So now I believe we're on
Okay.
J.
The Medicaid to Schools program.
I wish the DHHS were here.
If you haven't noticed it elsewhere, I think you did notice it. Aid to School Programs, House Bill 16, whatever it is, requires that they now address this issue, right?
Right, and remember when Henry Lippman came before us, he said we're leaving a good
Money on
hunk
the
of
table.
Medicaid
Yeah.
money on the table, probably around $5.5 million.
Yeah.
We were spending, what, 7.7, something such as that, as my memory recalls, and he said, you're leaving a good hunk on the table. That, is that, Rebecca, is that a result, do you think that maybe that what they get back from Medicaid doesn't pay for the labor?
Yeah, I would say that that's probably pretty accurate. I know that most of the people that work on it work in larger districts and are paid with some of those Medicaid funds because the value is that they would get even more funds with somebody working on it initially. I was just going to say that you can, Dwayne had mentioned beforehand, and I didn't realize this, that on their DOE 25, they report how much money they get from Medicaid each year.
Oh,
Does every district do that?
Every district has to do a DOE 25, so
So
yeah.
they all report how much they've gotten from Medicaid?
I don't know, like I said, I didn't realize it was on there. He mentioned that they have to report that on the DOE 25, so.
I think it's important to note there's been two districts in the state that are in financial struggle that they've themselves have reported, both Claremont and Rochester. And they don't, according to what I've heard, is Rochester doesn't do it at all. And Claremont fired the person who was doing it, but then brought her back after the fact. But Rochester is a different kind of situation too. The city-
Rochester did have somebody, so.
Yeah, they're not currently doing it.
Okay.
And I would say a district that large would certainly,
yeah.
that's not a small, I mean, I've got small ones, like Grantham and places like that that are tiny little districts. I certainly can see where not having a staff person, but
And I imagine Claremont is changing guard as we speak,
Well,
you
they're not
know,
going to do special ed aid.
picking up on things like this.
Again,
Yeah.
Put that in there. Keith and I put that in. You know, is this a place where we should be following up some of the recommendations, what we were advised by Henry Littman? And he mentioned the Colorado School Medicaid Consortium. They call it CSMC.
yeah,
And the CSMC is a nonprofit organization to help school districts and BOCES, you know, the Board of Cooperative Education Support, something like that, navigate, implement, and maximize federal reimbursement through the Colorado Medicaid School Health Program. It provides training, support, and advocacy to help districts manage billing for student health services. Should we be looking at something like that? BOCES are in over 40 different states right now. We don't have it.
I think what should be said is that many states have done this that you just described, and this should be looked into, something like that.
What I'll do is I'll look what he suggested to us, look at Colorado, but I'll also do the same there and put that, how many states are doing similar BOCES type programs. Vermont is just finishing up their program.
Okay.
And it provides this program, special education, to those districts wanting to get involved, and they have a say on that board to,
It says Board of what?
I'll get in the web and get it.
Okay.
I'll get what Vermont has and put it right in.
May I?
Yeah.
If my memory serves me correct, I remember Director Littman saying something like that with the new Medicaid to schools billing and the Medicaid billing changes, I thought there was going to be like a call center or some reference that he was making. Am I misremembering that?
nope, he did say that.
Okay.
Yeah, he did.
He did say they were gonna, the plan has
That,
like half a dozen
That
staff people
component.
built into it to assist people and train and all that.
so there is something that I think it would be nice if we had, I think in the previous notes, I had requested or we had maybe suggested a technical advisory from the DHHS. And so if maybe that could be in our report, meaning for the Medicaid to schools thing, a technical advisory issued to them. Is that something you're opposed to, Chairman?
I'm not opposed to any notifying people where
Okay.
it's going to take an effort, not just on the school district, so it's going to have to be a state effort. It's going to probably have to be legislation.
And I think my point was, while I'm typing here, is that if the technical advisory let districts know that there is this call center or whatever, perhaps folks would avail themselves of that.
Yeah,
Yeah, that's right.
yeah, I think we can hit on that too.
I do think the consortium idea is stellar. I do.
I did talk to several senators when we were talking about SAU consolidation. And some of them were talking not consolidation, but program consolidation, which is, I think, a better way of addressing this than, you know, whole structure organizations. But look at the program. How can we help as a whole? Okay, so we'll get that entered in, those comments.
Thank you.
Whether billing is in-house or outsourced and its relationship with student data privacy.
Oh, right. This,
I think we've heard from Rebecca, the student data privacy is pretty squared away.
Yeah,
I mean,
yeah.
they don't, no, there's no PII in any of that. It's just,
Yeah.
I do, however, Mr. Chair, if I may,
Mhm.
I do, however, think that if there are districts availing themselves of like a third-party biller, that may be an additional cost to districts. So that should be included somewhere else, maybe in our reporting.
And many districts are, if they are able, they are working with a third-party biller.
So where should we put that? Would that go in the cost to districts in section J?
No, I would say that it goes in K2 where it says whether billing is in-house or outsourced,
Okay,
because it is, many of them do outsource.
okay. Okay.
There are some local companies and then some companies out of Maine that many districts work with.
Are you okay with that, Mr. Chair?
Oh, I think we can suggest all kinds of things in here.
Yeah, that's right.
Maine may not be the model we want to look at, seeing they're being investigated for fraud right now.
No, it's just companies from Maine. It's not, not the state government.
I hate when that happens.
Well, black bears, what can I say?
Yeah, I know, I know it. Yep. Okay, so we can look at third-party billing, outsourcing it. Categories of reimbursement and rates therefore. ED 1129 addresses a lot of that.
So that addresses the categories that we look at for private providers of special education. It doesn't address other rates that may be submitted to Medicaid for reimbursement.
Like what? Would be not private.
So if there are other companies that districts are working with beyond the private providers, they may contract with a speech and language pathologist that does not work with a private provider. They may contract with the transportation company. It's not through a private provider, so we don't set any of those rates. We had the gentleman from Boothby come in, and he had said that they charge market value for their services, and districts pay that. We don't set those rates for those services.
And that's under,
We should set those rates.
oh, okay, thank you. I just wanted to make sure.
What's strange to me though is that rates for services for DHHS for some of this same population are regulated.
Right.
If there's a whole basically table of what DHHS will pay a provider, and you're locked into that range. I mean, it might limit who you get, I would be honest, because if you make the rate so low, you just won't get bidders.
So Rebecca, right now, from what I understand, those services, if they need to be contracted, is usually handled at the local level, i.e. the local school boards.
Correct.
Yeah, so they put out, and I believe it's anything over $10,000. There has to be an RFP that goes out and 3 bids, and it has to be reviewed. But in that scope, would it be even productive to try to put a cap on that? Let's just talk transportation. I mean, look at, we've just got the cost of skyrocketing.
Yeah.
If you've got a company that's going to provide transportation to one district, it's more than likely they've got a pretty good cohort that they'd be able to supply for other districts. So, I mean, I'm never into price fixing, but in the interest of trying to keep some lids on costs, would it be a good idea for us to think about a cap?
I think that it would be
areas?
beneficial to districts to have a
Yeah.
cap, yes.
Yeah. So, go ahead, ask.
No, I was just gonna say, what happens in this circumstance where, like, if there's a cap for, like, say, transportation, would they have to then provide some sort of explanation for why the cost may exceed something?
Sure, why not? Why not? I mean, in the interest of fiscal responsibility, and they're following everything that we've asked them to do, sure, an explanation of, it wasn't feasible at this time, but it's not to hamstring them, it's more to give them some guidelines on what's reasonable financially. So, because you can have a district that's paying $50,000 for transportation for SPED, and the same company doing the same thing for a district with the same number of students could be getting $75,000. It's all contingent on what the school district is willing to pay. So, I mean, we cap contracts in the state for a reason. It's a responsible way to manage our finances.
Taking it from an opposite position,
Go ahead.
we just went through an issue with school care where school care all of a sudden said, hey, we're short big dollars. How much did Manchester get charged above and beyond?
They didn't. They weren't a part of school care.
Okay, whomever then.
There are many
we had
districts
over
who got,
100.
There's a lot of
there are many
districts.
districts who got surprise
They
billing.
got nailed, Londonderry and some of the others. So, and it wasn't just school districts, some were emergency management, yeah, through municipalities. And so in order to stay viable, school care had to charge additional dollars. They went beyond their best estimate. There have been other years where they had given money back. Or so they're going to have these peaks and valleys. I think that even when you're filling up your oil tank right now, you may have an agreement for 1 year where it holds at a certain level. But I don't know if I'm, as a school administrator, going to want to make a deal much longer than that when I don't know. I'm living in an inflationary period of time right now, and the market value and everything is all over the board. I'm going to get the best deal I can for a shorter period of time. I don't know. Price of fuel might go down, $1 a gallon from $4.34 or whatever it is right now, propane, down lower. So I don't know. It's I don't know whether capping is the best way to deal with this.
It's a ceiling. It's not a floor, it's a ceiling. And I think anybody who's trying to plan out a budget or future expenses has to put a ceiling at some point. I'm not saying to make it unreasonable. I mean, we could allow the districts to take an average of what they spent on, just say, transportation over the past 5 years, average it out, and that could be their ceiling. So it's not to make it restrictive, it's to help people get a better handle on what they're spending at this point and possibly project in the future for higher costs. So just an idea, just throwing it out there on the wall, see if it'll stick.
Yeah. I think that you can't have an absolute cap where there's an obligation to provide. If we're talking about transportation, it has to be provided.
I'm just using that as an example,
But
representative.
whatever it is, it can't be an absolute cap, but it can be a point at which special process enters into it, And an example of that just is on this page we're looking at, LKL, is the quote from HB 1563 of trying to get available revenue sources and accessing, in this context, Medicaid. And so the district has to demonstrate, and if it's not getting Medicaid, that it has fully access to the maximum extent possible other available revenue sources. That kind of language is what would need to go along with a statement that transportation costs are accelerating at levels that are beyond where they should be, and to try to get a handle on that, every district should adopt a target,
Thank you.
and then if they go over that target, there should be some process, something like that.
Sure. I mean, and technically that's not a cap, but it's along the same lines of what I think might be helpful.
Yeah, it's flagging something so that
Yeah.
special effort has to be made.
Exactly. Exactly.
And I feel like, may
Please.
I, in the event of something going out to bid with an RFP and you get 3 RFPs back that are all similarly high but outside of that tolerance, like if we're putting a cap, then what would you do, or what would you suggest, I guess?
We've sent out an RFP. and
Yeah,
we've
if they,
got three
right, if they've
responses,
done
and
Right.
everything, if they've done everything in spite of their best efforts, they can't come in with that cap, then they don't have a choice. I mean, they're legally bound to provide transportation. So, they could alert the state and let them know this is the process that we followed. We followed the guidelines of this particular RSA. We're unable to stay within that, and this is where we're at. So it's not to hamstring anybody. It really is just to be more cognizant of what's going on with that type of money. That's all.
Rebecca, are there rates established nationally for a physical therapist or a speech pathologist or any of these?
Not that I'm aware of, no.
I just want, along those lines, I spent 35 years as an occupational therapist. And my primary focus right out of college was psychiatry, which OT doesn't exist in psychiatry anymore, unfortunately. And then I moved on to cognitive disorders of the elderly, dementia, Alzheimer's, multi-infarcts, TIAs, whatever would affect cognition in the elderly. And the only way I got paid was through billing. Even if I worked for a large hospital or long-term care facility or a skilled nursing facility, the only way I got paid was through billing. And that billing was capped on every visit. There was only so much amount of time and so much amount of money I could collect for each unit that I delivered. And every diagnosis had a set amount of visits that would be covered under that insurance. So i.e., if you had a person who had a CVA and they didn't have significant hematopoiesis and, you put in a pretty good therapy plan and they were working that therapy plan, as long as they were showing progress, the insurance companies would continue to reimburse the company that I worked for. If that particular patient or resident stopped showing progress, they would no longer pay and have you reevaluate to see where they were at. So I don't understand. And Medicaid does the same thing. Medicaid, not Medicaid to schools, but Medicaid overall at a state level does they work along the same rubric when it comes to billing for therapies. So, and don't get me wrong when I say this, is there any way, would it be at all feasible to take a look at each of the diagnoses and see the units that go into it, what works, what doesn't work? I mean, it's a big nut, Rebecca, but I've been thinking about that because, like I said, 35 years as an OT, you get familiar with insurance companies, unfortunately, the good, the bad, the ugly. And I just distinctly remember that each diagnosis had a certain amount of visits. As long as they were showing progress, they'd reevaluate after 60 days or 90 days. So tell me, impart your wisdom on me.
That would be difficult because every decision is made by an IEP team. I feel like I say that a lot.
No, that's
but
okay.
It's hard to even put it into categories or kind of cookie cutter it because one IEP team is not going to make the same decision as another one. They're not going to say the same things for similar students. It's intentionally that way. It's intentionally done that way so that you can ensure they have an individual education program.
Sure. No, I
So.
understand that. I understand that.
So it would be difficult.
Yeah, I don't know. Just like I said, I think outside the box. I'm throwing it against the wall.
Yep.
Do the insurance companies, you talked about them, do they set a range of acceptable rates which they will pay out for? Does Medicaid do that? In terms of Medicaid to schools, do they have a range of what they're going to pay for the service of, for?
I don't know.
That'd probably
Yeah.
be helpful for DHHS to be.
Yeah, I think from what you described, Rebecca, that a district wouldn't know what they were being reimbursed for if that was 40 hours of OT for Johnny or 20 hours of PT for Susie. It would all be in one big pot of money. So
But they just don't even break it down. They don't give a reimbursement schedule. This is how much you, that's a problem. That's a problem.
Well beyond me.
Nothing is well beyond you, Rebecca. I'm sorry. I have faith in you.
I mean, I recently was involved in something where the service for a behavioral provider, and the rate was $180 an hour. And I know that person is not getting $180 an hour, that the companies, there's insurance involved for liability and stuff, but these are Cadillac level pricing.
What do you think of that? Why don't we have listing of what reimbursement rates are?
I don't know why we don't have a listing.
Well, it's not
of
her. She
reimbursement
doesn't
rates.
do it.
Yeah,
Are you asking about DHHS?
Yeah, Medicaid is.
Okay, I just wanted to make, okay, so you're asking about reimbursement rates from DHHS, okay.
yeah.
And there's a huge disconnect between DHHS. It's not as a slam, just at the state level, DHHS and the Medicaid schools program and you. There's no interface. And yeah, is there, Megan?
Well, I don't know, but I thought that perhaps the new Nessus, like, configuration might maybe talk.
We had hoped that the new Nessus configuration would talk to the Medicaid to schools, and then they went and got a new system. So now we have to find out if the new Nessus will talk to the new
Will you keep us
Medicaid to
updated
schools.
on that? Because,
Yeah.
you know, that, I think that's really important. I think things are being missed, not intentionally, but because the systems don't interface. So, yeah, keep us updated on that. Some of us will be back here, some of us won't. You know, hopefully we'll be back, but
I mean, some of those providers are the same though, too. So Easter Seals is also a provider for DHHS. And the same service that a school might use through them and bill to Medicaid, the DCYF could use for the same student for services at home, and it would be the same. So I think some of those folks that cross over that do both, like Boothby doesn't work for DHHS, right? But the Mount Prospect, Spalding, and Easter Seals, they're all providers for both. So we would know what DHHS would know what those rates are for them, for example. It could give us an idea for at least Representative Freeman if it was, they charge.
I'm not sure they set rates for like OT-PT speech. I know they set rates for residential and tuition. And
No,
things like that.
again, more like RBTs.
Yeah.
That type of stuff that there would be a rate for.
poor Rebecca.
Okay, anything else on this K item here? Okay, let's go down to L.
Now we're on it. Sorry.
Use of insurance by local districts to contract for legal services.
think
Well, we've got
that really got it.
We just took it right out of
Yeah.
proposed law.
Yeah.
Okay, M. Graduation rates for students with disabilities by type of diploma and age and attendance in adult learning programs. That we've never gotten, never asked for it either.
We have that information in our state performance plan annual performance report, so we could provide that to you
Okay,
for graduation rates.
That's graduation, not completion, right?
We track graduation, we track dropout, we track certificate of completion. And within dropout, there are, I think, 8 categories. So we track all of those per our regulations for reporting to the federal government.
That sounds like just what they're looking for.
And so this includes, as I'm typing, I meant, sorry. This also includes certificates of completion and diploma track?
Yes.
Okay.
The only thing I wouldn't have of that question is the attendance in adult learning programs.
would Steve Appleby have any of that?
That would go through our adult education in,
Doesn't he take care of that?
no, it's in our division under Melissa. It's with Chrissy Vanderhook. It's a new bureau name and I can't remember it. I apologize. But it's adult education and CTE. I don't know if they would know how many of their students are students with disabilities. Because that's what it's asking for, is how many of those students are students with disabilities.
Usually those are adults
Typically, yes. Yeah.
or over 18.
But I was gonna, but
Over 22.
a 21 inclusive age student could also be in a diploma, or in a high school program still, correct?
Yes. They could be in a high school program. if they are in I will just state that if they are in an adult learning program or they're going for their high set or their GED, it's considered a dropout for special education. So they'll be inadvertently in our numbers for graduation and dropout.
Okay, so you said you could get that for us, Rebecca?
Yep.
Okay, so that takes us through M, and that's the last requirement within the,
There's a couple things on
yeah, those are just add-ons to M.
okay.
They came out of the Edunomics.
Edunomics, that was a great chart. That was a great chart.
It just tells you how the staff's being used. Some of them might be moved around a little bit. Maybe all that information ought to put in one location. But that takes us through it right there. So we could come back, try to, if we get these minutes, Megan, and usually you have them to me within an hour or two after we leave here even. That's
That is
exceptional.
why I nominated her to be clerk.
Yeah, wow, it's great. So if you could get that to us, then we could start putting this together and come back. And the minutes, can you send those minutes out to everybody that's here today?
I will certainly have Jen. Is Jen sitting there?
Yeah, she is.
Jen's always here. She never leaves.
I will send them to you and Dick and Jen when she's ready.
Okay,
Send them right out.
and then Jen, for those people that are here right now, they're gonna understand how to work with that stuff. Then we might be all give it a little stab and come in on the next, what is the 15th? 16th.
I was just gonna say our next meeting is
16th at 9 o'clock.
June 16th.
Is that in the calendar already, Jen? Okay,
It's only Tuesday.
it's only Tuesday.
You have a couple days.
Feels
So
like
our
it's,
next meeting is June 16th at 9 a.m.
okay.
9 o'clock.
With the goal of wrapping up.
Well, we've got it.
Yeah, bringing breakfast.
Here.
Hey, I'm on vacation.
I'm glad somebody's on vacation.
Is the goal to try to wrap up
That's
on the
it.
16th?
Yes,
Yeah.
yes, that will be our last meeting.
Yeah, okay.
And then any additional, Chairman Ladd, so I just so that we're all clear here on the 16th, are we expecting that we will walk away with a draft version of whatever report?
We will probably walk with some form of a draft.
Okay,
However, it'll be finally put together after we have all that information and input that's going into that draft. So there'll be probably a lot of penmanship and scribbled into it. Then we'll have to get the final version mailed out to everybody following
Yeah.
that.
so,
So what we can do is we can do what we do at the CFCs. We, we have an amendment made. We don't have the amendment finalized by legislative services, but we agree to the language which is in that draft format, and then we're good. It saves having to come in for another meeting.
Jen, does that work?
I'm gonna be away from the 23rd.
Yeah,
Yeah. Jen, does that work? Yeah. Okay,
yeah.
Basically, what we'll be doing is voting on a draft with any changes.
Yeah,
okay,
And
yeah.
then we'll circulate, a revised version.
Okay.
To make sure that everybody's comfortable that all of the changes are reflected in the final.
Yeah.
Without having to come back, but you'll just respond to Representative Ladd individually and then answer, or if you are doing like.
okay.
Good work today.
Yeah. I do have one sheet I was going to share with you because I can remember one of the meetings, we had an extensive conversation on EFAs. I think that was one of our initial meetings. And I had some draft language in here. But I think what I'll do is I'll bring it, on the 16th. I'll bring it in a printed copy and all for everybody with the supporting rule which supports that, which we had. It's the same stuff that I got from Gen 4 here. Yeah. So we'll have that to look at too, because that is a cost which we should recognize. and it's special ed. So with that, I think we're done with this meeting, and anything else from anybody here? We are adjourned.
Thank you, sir.